are going to play a crucial role to reduce above statistics. To throw more light on how we can achieve this, we have Dr. Uday Bodhankar sir. Dr. Uday Bodhankar sir is MD FRCPCH. He's former national president of CIAP. He's former member of Advisory Council of Government of India. He's ex-professor pediatric IG Indira Gandhi Medical College, Nagpur. He's executive director ComHAD UK. He's a deputy chairperson CHPA UK. So international dignitary is along with us, and it is our pleasure to have you, sir, here. Over to you. Thank you, sir.
The presentation. Good afternoon to all of you. I respected Phadke madam, respected Nair madam, Dr. Patil, and respected First Lady of IIP, Dr. Kinwadekar madam, and all respected delegate, men and madam, and all people. You know, it's very difficult to talk after a sumptuous lunch, even after having ice cream. Yeah, but anyway, I will try to keep you awake, because after me there are people like Anand Deshpande, Menon madam going to speak. Anand Deshpande बोल रहा है, मत है क्या roll up petition. Me दोनों के लिए होते हैं. I was given task to speak both, but I will take roll up petition. इथे roll up petition इथे. So Dr. Phadke madam requested me to talk on roll up petition, which I will not take more than 10 to 15 minutes. So, from in the morning, I actually the previous speaker spoke about. Single one.
Sir, voice is clear. Sir, your voice is clear.
It's a single side. Single side
slide share मध्ये जाऊ आपण slide share
इथे फक्त करते हे खाली याला
slide share कर
याला कर बस कर हां ठीक ओके
हे मिनिमाइज
करायला कसं हे मिनिमाइज करून स्पीकर वर याला मिनिमाइज कर याला हां खाली तिथे दिसेल ना yes so anyway good afternoon to all of you. I was given task of speaking two topics. One was role of pediatrician in nurturing care for the child development. वरची लाईन करायची का
आणि फक्त ह्याच्यावर क्लिक केलं सरांच्या ह्याच्यावर नाही यांचं काय
पिन
व्हिडिओ पार्टिसिपेंट
हां बस दॅट्स ऑल.
अच्छा दोन्ही पाहिजे का तुम्हाला
नाही ते येत होते देशमुख सर येत होते.
अच्छा I welcome Dr. Sanjay Deshmukh, EBM IIP. The topic which was given to me by respected Phadke madam was role of pediatrician in nurturing care for ECD, which I will try to finish with my slides. You all know that globally more than 250 million children under the age of 5 years, they are at risk of this thing, development and potential due to poverty and stunting. Additionally, you will be surprised that around 40% of all of them of 3 to 6 years don't have access to, don't change it. They don't have access to preschool education. Now coming to, because of this issue, in 2018, the WHO, UNICEF, we have got Nair madam and World Bank, they thought of coming out with new strategy, that is nurturing care for early childhood development, a framework for helping children survive and try to transform the health and human potential. As you all listened today with Dr. Samit Dalwai, who told you about how responsive feeding should be, not only nutrition care, but responsive also was there. So with this, to bring attention to the earliest interaction as a way to promote health and human potential, the framework incorporates the science behind early childhood ECD and advocate for policies and intervention with the greater potential positive effect. Now coming to why we are going to emphasize more on as you know, 1,000 days, or Dr. Menon Madam is going to speak, but why you have to emphasize on 3 years age group or 3 to 6 years? Because if you want to know phases of early childhood development, you all know better conception to the conception to birth during gestation. Previously we are knowing that in pregnancy we have to take care of our health only, immunization, nutrition. But in addition, the brain development is influenced by the pregnant person, not only health, but nutrition and environment and emotional stress also, which is a new thing coming, and we have to take care of that. Promoting healthy prenatal brain development involves reducing risk related to insufficient nutrition, infectious diseases, exposure to toxin. That's why we have to take care not only 1,000 days, but it has come to birth to age 3. By age 3, why we are emphasizing for 80% of the brain architecture has been built by age 3. And again, another age 3 to 8 is coming because early learning opportunities, they become crucial during that period. So now, Dr. Ramakant also told you in the morning that there are 5 components of the nurturing care. Number 1, good health, which I think somebody will take topic. Secondly, adequate nutrition. We have got expert here, Dr. Menon, Dr. Nair, Dr. Parkemanam. They are going to speak. Safety and security is 3rd. And 4th is opportunities for early learning. And last one, which we are talking in the morning, was responsive caregiving. This is very important take-home message for all students who are here. I welcome them. Good health, we already take care. Adequate nutrition, we take care. Safety and security, we don't emphasize more in our busy practice. Opportunities for early learning, we in our OPD with this ECD, Nair Madam, we have started incorporating this in our OPD, which are not there previously. As a pediatrician, we in OPD, average OPD, Dr. Anand Deshmukh, we see around 50 to 100 patients. So it is not possible TQ type. But now with the learning of this TOT, which was there held in Nagpur, we have taken some resident in our OPD, and we have given them some room for counseling on good health, adequate nutrition, safety, and opportunity for early, and most important, responsive caregiving. So that we have learned only because of your intervention, ECD. And I request all pediatricians who are there now. We have, Madam, we have got more than 38,000 pediatricians as the members of IAP. We are, but in India there will be 75,000 pediatricians. Now, why it is very important? As you all know, the target MDG goal which we are going to achieve. Target 1 is by 2030. एक मिनिट शीतल माझा फोटो आहे ना, फोटोला मिनिमाइज कर, खाली घे तर मला स्लाइड दिसत वरती घेतात फोटोला, नाही खाली घे, इथे कर्सर नाही वरती नाही, हां बस बस बस. By 2030 our goal is to reduce at least by half the proportion of men, women, and children of all ages living in the poverty in all dimensions according to the national definitions. Then second target is is end all forms of malnutrition, including achieving by 2025 the internationally agreed target on stunting and wasting in children under 5 years of age, and address the nutritional needs of adolescent girls, pregnant and lactating people, and older persons. This was new one added. Now, third one is by 2030, we have to end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live birth, and under 530 to at least as low as 25. In the morning, Dr. Simini Rani has shown you how India stands and where Maharashtra, Nair Madam, with the help of UNICEF and UNICEF, we are standing better than all India. But of course, Kerala is number 1 state always. But this is, we have to achieve at pan-India level, not only state. Secondly, by 2030, we have to ensure that all girls and boys have access to quality early childhood development, care, and pre-primary education, so that they are ready for primary education. And lastly, this is the addition one, we have to see that we have to end abuse, exploitation, trafficking, and all forms of violence against and torture of children. So these 5 targets which have been given, we have to see to it we achieve by 2025 or 2030. Now, as a pediatrician, what is our role? We have to ensure that children have access to good quality health and nutrition in OPD. We should have corner for nutrition. We should have corner for ORS, diarrhea. We are having in medical college diarrhea center, nutrition center. The same thing you can do in your OPD, whichever time you got. I know every pediatrician, madam has come from China. We are all busy, but we must dedicate our some time for counseling because we are very busy in OPD. So you have to employ some RMO. Even I don't mind here employing some Ayush people like BML. I have got some doctors who are BML, but they are doing good job as a counselor. We need a counselor. We don't need their treatment. So that you can do. Make health and nutrition services more supportive of nurturing care. Increase the outreach to families and children with the greatest risk of suboptimal development. And lastly, establishing specialized services for families and children with developmental differences and collaborating with other sectors to ensure a continuing care. So this is what is there. Now, if you want to do as a pediatrician, what things are there, as madam has told me to give, you have to identify and call out positive caregiver behavior during your clinical visit. As I told you already, we have to implement a standardized screening protocol for early identification of children with developmental differences, e.g. at 6 months and 12. We have got our clinic, we see 3 months, 6 months, 9 months, 12 months, and then 15, 18 months. Those children who have got a history of hypoxia, who have got hypoglycemic seizure, who have got developmental delay at earliest. Ensure families, they are asked about food security, play, stimulation, as Dr. Samir was telling you, must play with the children in OPD at home, and safety question during every visit. In addition, you have to identify and connect with referral resources within your community that support children with developmental differences. And lastly, engaging with childcare providers and school to build collaborative relation with community. This was a very dry topic which was given, but I will try to make it short and sweet. In another thing, we have to keep and maintain easy access to resources for social and legal services to support patient needs. We have to volunteer to speak, which is important. We have to volunteer to speak in the community, e.g. places of worship, schools, community. And wherever I go as a member of Command, IIP, and I try to speak on behalf of them. Yes, madam, welcome, madam, Dean, madam. Yeah. We have to see to it that we speak for the organization, for the community, for the children, for the parents. And that is about nurturing care, ECD, and the importance of supporting children with developmental differences. In addition, lastly, join the Early Childhood Development and Action Network, madam. Nayar, madam, this is the ECD and share experiences with the ECD community. Lastly, engaging a local, national, and global ECD discussion to ensure health sector advocacy. We as a pediatrician, what my appeal as a past patient RP, we should be advocate and we should implement what we are going to be role model in the society. What we teach, what we preach, what we do in the OPD. In OPD, madam, we distribute Rajgira Laddu. I don't distribute chocolate Cadbury. So that is followed by more than 100 students who have been trained by me this year, on this year. So we don't encourage any of the wrongdoing like Cadbury chocolate, junk food, junk thing. They are given Rajgira content protein and it contains good jaggery, so it gives also iron. So this type of should be role model. Now coming to the end, welcome Samir. This is what he is right. Government should provide children their right. If not provided, their future won't be bright. Society should stipulate the rights provided. If not stipulated, children growth will be retarded. Parents should give love and affection to their children. If not given, there won't be growth of their brain, which was rightfully said in ECD. Teachers should provide children environment for a while. If they don't provide, student life will be boiled. Government should provide children their name. If not provided, their life will be full of pain. This is the poem I got as a thing. Rights should be given to the children from whole. Everyone is participated in the dimensional development role. Now you all know while dealing with ECD, this is what children learn, what they live. This is poem. If children live with criticism, they learn to condemn. So you should watch how you behave in your home, how teacher behave, because up to 3 years, you are the role model. When they go to school, their teachers are role model. When they grow up in peer, their companion, whosoever friend, they are the or teachers are the role model. So this is what you have to watch. If children live with hostility, they learn to fight. If children live with ridicule, they learn to be shy. If children live with shame, they learn to feel guilty. If children live with tolerance, they learn to be patient. This is important. If children live with encouragement, they learn confidence. This is what you have to encourage. If children live with praise, they learn to appreciate others. If children live with fairness, they learn justice. This is what you have to encourage, positive thing. If children live with security, they learn to have faith. If children live with approval, they learn to like themselves. If children live with acceptance and friendship, they learn to find love in the world. So this is what positiveness we have to inculcate in the children as a pediatrician. This is another one which I am not going to detail, that how the child is like let divine respect them, energetic, nourish them, they are tallyable, embrace them, their gifts and unwrap them. Here now I will not go. This is the poem which I wanted to share. You can take it afterward, but I will end. I will not take our 10 minutes only. So I was going to talk on other lecture also, but Dr. Anand Deshpande is going to take. So in the end, for those students who are here, PG intern, the last poem is for you. This is the poem for doctors. Baby, baby, yes, papa. You become doctor, yes, papa. Lot of tension, yes, papa. Family life, no, papa. BP sugar, high, papa. Yearly bonus, joke, papa. Monthly pay, low, papa. Personal life, loss, papa. Weekly off, ha. This is in short, this is the story of a doctor like me who is practicing. We don't have life because we have to work 24/7. Even we work on Saturday, Sunday. There is no holiday. Sunday also I have to go to the hospital to take the round. So that's what I requested, madam, you take your workshop on Sunday. I ready, all practicing pediatrician will come and attend your lecture, because today we could not see practicing pediatrician. They are busy in their practice. They will be free by 3 p.m. 3 to 5 p.m. and then they will go back 6 to 9 p.m. So my request to all that UNICEF workshop should be held only on Sunday if you want to attend practicing pediatrician. I'm not talking about teaching. Even teaching college, they are also practicing, most of them, though they are not. So with this, I think thank you, Dr. Parke madam. Thank you, Dr. Nair madam. Thank you, everybody, for giving me opportunity. Thank you. Yeah, and this is my daughter, Priyanka, and this is the end.
Excellent ECD.
Thank you. चल में music.
Music
हाँ.
का?
Video नहीं आला. ऐसा का बोल.
You put the video.
Okay.
Time is no constraint. I don't think so.
Okay.
नहीं तो video में जो
Earlier
बता
times,
आवाज आता
had
होता.
been taken by
I know, but I had taken 10 minutes. तो video में आवाज आता है तो of course. Thank you.
late for so many. Excellent.
Thank you.
हसण्याचा आवाज होता वाटतं.
तो वेगळ्या याच्यावर होता का सर? डेस्कटॉपवरच होता?
डेस्कटॉपवरच होता तो. डेस्कटॉपवरती ठेवला होता तो वरती आहे.
नाही दिसत.
हाँ,
yes.
तो काही नाही.
I think needed to wake everybody up. Okay, so next lecture is without. Yes, thank you, sir. Thank you. Before you were before the time. Next lecture, without wasting much time, is by Dr. Pramila Menon ma'am, ECD 1000 days. First 1000 days. Madam is Associate Professor at Dr. D.Y. Patil Medical College, Pune. Ma'am is also UNICEF State Consultant, and apart from MD PEDS, ma'am has done PG Diploma in Public Health Nutrition and has got PhD in Genetics. So many, I mean, I don't know how you get the time to study such a vast subject of genetics. Yes. MUHS, ma'am has been MUHS Senate member from the year 2012 to 2017. Ex. Ma'am is also ex-honorary associates at Sydney Child Health Program, University of Sydney. We know that the first golden hour, that is the first hour after birth, has been given so much importance, as it's the first sensory input mother gives to the baby, the first eye contact, the first touch, the first smell of mother, the first sound. It strengthens the mother-child bond. Brain wiring, more synapses are observed in a well-stimulated child. To throw more light on cognitive, emotional, physical growth during antenatal period and first 2 years of life, we have Dr. Pramila Menon, madam. Over to you, ma'am. Thank you.
याच्यात होतं का PC मध्ये पेनड्राईव्ह लावलेला आहे पेनड्राईव्ह लावलेला
लोकल टेस्ट सी
खाली नाही खाली का पेनड्राईव्ह मध्ये दिसतंय ना
पेनड्राईव्ह तुमचं कुठलं आहे मॅम सिलेक्ट
डेस्कटॉपला आहे का हे काय पेपर दिसतं
वरती पूर्णपणे जात नाही का ते वरती जात कारण कसं आहे जेव्हा हे फुल स्क्रीन होते ना ते ऑब्स्ट्रक्ट करतं
त्याला आता मोठे करून कधी शेअर करायचं आहे
आणि हे दिसतंय
Is it possible to make full screen, please? Please. Yes, it is visible.
त्याला ड्रॅग करून घ्या
So, respected Padke madam, senior teachers, IIP president, my colleagues, UNICEF consultant Dr. Raji Nair madam, Mangesh, and many respected teachers in the group and many teachers, students who are here. So, this is a post-prandial session, and what I am going to talk will be first 1000 days. I think since morning you have listened to many sessions, and I want to just say that we said it is, I like a pediatrician morning, I think there was one speaker who said that as a pediatrician, you should remove your ego saying that it is, I am going to examine. And he said, now we are going to talk about you are going to examine the child. But I go further ahead and I say, we are going to see the child, we are going to own. So what is this first 1000 days and early child development? And I'm sure all of you who are youngsters here, who are going to be future parents. And I'm sure this first 1,000 days is very, very important window of opportunity, which I will be covering in the following points like importance, nutrition, some IYCF practices, stimulation, and Government of India initiative. So for student session sake, I would like to explain what is this 1,000 days. 1,000 days comprise of this pregnancy 270 days, first year 365, second year 365 makes the first 1,000 days. And this is the first 1,000 days window of opportunity. Why are we saying? Because I would like to ask one question to all of you. How many of you know your height at the age of 2 years? Any guess? Students? President is answering. So just whatever is your height, just divide by 2. If you are today 150 centimeters, divide by 2, 75 centimeter was your height at 2 years. So this much is the opportunity available at 2 years. So imagine if suppose the child, if you want your child to be tall, you must invest in first 2 years. The child becomes 100 centimeter. Definitely this child who is going to become 200 centimeter when he becomes adult. So we must focus on this first 1,000 days. The evidence has already come out. I think morning, Irani madam and many speakers have stressed on that whatever happens in first 1,000 days, this is going to define what is going to be his adult potential. So we have seen stress, poverty, depression, and I think my next speaker, Dr. Sucheta, is going to speak about the maternal mental health illnesses because that also can affect the baby. So all this will affect the baby and the baby may go into malnutrition and baby may become stunted. So it's very, very important for us to define what is affecting this first 1,000 days. The evidence has also shown that the children who get stressed out during this period, they also develop non-communicable disease like diabetes, hypertension when they grow up. So to prevent all these things, first important message, continue breastfeeding. Breastfeeding during first 1,000 days, and not only breastfeeding alone, but it is a responsive feeding. What is that message? Responsive means mother should speak to the baby. Mother should play with the baby. Whenever she is feeding, this is an window of opportunity because baby's brain is very, very active. Baby is looking at the mother and is learning so many things. So these are the messages. It's not only the breastfeeding, but responsive feeding by playing with the child, speaking with the child, singing with the child. So that will stimulate the brain of the child, and this is going to affect the baby's ability to grow, learn, and thrive. So we are not talking about the survival, but we are also talking about the quality survival. So this is very important, and this is indirectly, if you get healthy baby, this is going to become healthy, a healthy adult who will earn more, who will also get more, the healthy society, healthy community, and healthy nation. So you can see this is the first 1,000 day hub. The website is available, www.1000days, and you can see whatever you do during pregnancy, right from health, nutrition, her mental health, mother's mental health, avoidance of many toxic stress or agents which will affect the fetus. If you prevent this, if you take good care of the baby in infancy, definitely this child is going to have 10 times more potential, more schooling, and more earning capacity and healthier families. So this will, I think this Irani madam has already told you how the brain grows almost 80% by 2 years. So the neurons are developed, the neuronal connections needs to be strengthened by stimulating. So any mother who has got low BMI, who is malnourished, is going to give rise to the low birth weight baby, and which indirectly increase the burden in the society. So this is the intergenerational cycle. The low birth weight baby becomes a low birth weight mother, and this low BMI mother later on again delivers small baby and small adult. So this, if you want to break this cycle, we must focus on this first 1,000 days. So what are we going to? I think morning you saw how the story can be changed in the beginning. Now we say second thing by Albert Einstein. If you want your child to be intelligent, read them fairy tales. If you want them to be more intelligent, read them more fairy tales. This is going to stimulate neurons, connections, and wiring is going to become dense. So parents need to spend more time in this first 1,000 days, first 2 years. Previously, we used to think that brain depends on the genetic makeup. It is not the genetic, but it is the atmosphere, environment, and interaction with other people is going to make the changes in the wiring. Previously, we used to think that the child doesn't understand. Actually, the child, if you touch the head of the child, you will feel that the child's head is hot. The metabolism at very, very at high peak. If you compare to adults, his brain is acting very fast. So this is the first 2 years, first 1,000 days, when the baby even is in the uterus, is listening to the mother, listening to the parents, family members. So this is the opportunity where the baby should be given not only nutrition, but stimulation therapy. So this is a very much important. Toddler's brain is much more active than the brain of a college student. So this is old thinking is changing, and the new thinking is telling you that do something in first 1,000 days. Definitely this is going to change the scenario. And this is how you can see the evidence. I think morning Irani madam has already told you how the wiring affects. This is the baby who has got stressed out. His brain has become very small. The baby who is developed normal, who has got normal, his brain is normal. So you can see the size of the brain, neurons, connections, all is going to get if the baby is getting into stressed condition. So if mother is stressed, baby is also going to undergo that stress, and the baby's brain is affected. Neuron number will come down, connections will come down, even baby's responses will come down. So this is very, very important. What happens in early child can matter for a lifetime. This is not only that period, but it is also going to affect in the adulthood. And this is again, you can see the pictures. This is evidence which has shown that how the brain of the baby who is affected. And these are the orange spots which are showing the activity of the brain. The baby who did not get proper response, you can see the neglect has diminished the brain power. But the baby who gets good response, you can see these orange connections are developing fast, and the baby develops normally. And this is the scenario which you find in orphanage. Orphanage, because nobody speaks to these children, they give only nutrition, nobody plays with the children, and these children don't react. Hence, early adoption, early stimulation, early interaction with the caretaker is going to change the scenario. This also affects this significant adversity in the first 1,000 days is going to affect his brain potential. So also it's non-communicable disease and many other mental health, even criminal rate is also is going to be more in the society. So all these things, if you want to reduce, you need to do something in this first 1,000 days. And this is again another study from Jamaica, which has shown that the children, there were 2 groups of children. There were children who were given only supplementary nutrition. The children were also stimulated. And the third group was the children who received stimulation plus supplementary nutrition. So the children who received nutrition along with the supplementation, that means play therapy, they did better. So this is very important. Giving there are students who want to come in or want to go out. Okay, so no, let them get settled. No problem. No problem. I have got patience. If your brain is at rest, only I can talk, because I also know that the thing is that my talking is also going to disturb you. Similarly, the way in which your movements also are going to disturb my brain. Okay. So let me explain you that this very important study which is done in Jamaica. One group of students were given nutrition, one group received only stimulation, and one group received both nutrition and stimulation. And what do you understand in stimulation? It is only not only food, but playing with the child, talking with the child. Even they involved the mothers making toys for the babies, and then they found the children whose mothers were caretakers were playing with these children, and they were receiving nutrition, did better. So this is the evidence. And what is the senses which we need to stimulate? It is the touch. What we do, I think all of you must be aware that in utero, तुमच्या सगळ्यांना अभिमन्यूची स्टोरी माहिती असेल, बरोबर आहे? तर अभिमन्यू, we hearing, and madam, as I think Irani madam showed you some of the slides, the baby can hear in utero right from 6 months onward, touch. So all families members should be get involved with all these type of they're making good stories. Baby can listen to the songs, and the baby, I think morning madam also showed you one picture of father interacting with the baby. So the baby mother, that baby could understand the father's voice. So similarly, baby can differentiate different voices and they can respond. So in utero stimulation by voice, touch, and different type of stimulation, giving good relaxation to the mother by in the form of yoga or some good nutrition and good mental health, definitely is going to change the baby's scenario. So baby's brain develops very, very fast in this first 1,000 days. And this period is also very sensitive or golden period, which you can utilize in a best way. very important thing, the story of baby begins much before the birth, and that is the important reason. Many things can wait, but the baby cannot wait. So many times, I think in many forums, when I spoke about all these first 1,000 days, there were mothers who started crying. They said, my child has gone now become 20 years. I had lost that opportunity. So my advice to those parents were that now you do it for your grandchildren. And I see all young children, young crowd, and I'm sure all of you, if you know the importance of 1,000 days, please, you all being a would-be parents, you should utilize this knowledge for your own child. There is also other concept, flavor bridge. Flavor bridge means mother what she eats. Particularly if mother takes diverse diets, if she takes multiple food groups in the diet during pregnancy, these children also start having good complementary feeding practices. When baby starts eating after 6 months, multiple food groups baby will easily accept. So good type of taste can be developed if mother also starts practicing this diversity in her diet. If she takes colorful diet, this is going to definitely reduce micronutrient deficiency, which is also known as hidden hunger. So very, very important. So we advise pregnant mothers to take variety of fruits, fruits, vegetables, dairy items, non-veg, whatever she likes, so that baby also get used to this flavor. Very, very important thing, other thing in morning, what we saw is a kangaroo mother care. So it is not only skin to skin contact, but baby mother should look at the baby's eyes. You know, when the baby's brain is very, very active in initial 15 days, instead of weighing the baby, cleaning the baby, giving for injection, just put the baby on mother's breast, on the chest. Let the baby and mother be together, even before cutting the cord. And this baby mother interaction, and when the mother is looking at the baby, that is the active period when the brain's neurons are getting stimulated. And you can observe that mother, many times mothers also speak some God, some name to in the baby's ears. So this brain is stimulated. So this is a very good opportunity that initial 15 days, this is beneficial for mother and baby. I think day before yesterday, I happened to take the birth attendant, special birth attendant training. And I found some of the nurses told me that when this type of things they were doing in their practice, they found mothers' anxiety, depression came down. Mothers also had less bleeding, less postpartum depression, even PPH. So there are definitely advantages to the mother and baby. So this is the period when the baby and mother should be together in first 15 minutes. This will also reduce your lactation, inadequacy of the lactation. Many times you find lactation failure, which can be avoided if you use this first 15 minutes with the mother and baby together. This is going to improve this bonding. This will improve the connection of wires on the brain of the child, and this is going to improve the IQ of the baby. And now we advise antenatal mother should be shown this breast crawl CD, and she should also be told about this first 15 minutes. And definitely if you show this thing to the mother, pregnant mother, immediately after delivery, she will be motivated to do this breast call or skin to skin contact. And then 15 minutes, she would like to watch her baby, talk to her baby. And this also lays foundation for parent and child relationship. I would like you to get introduced to Mother Child Protection Card developed by Government of India in 2018. This is a very important communications tool available. 2018 onwards, all our Anganwadi and Asha workers are trained to use this as a communication skill, communication tool. And I think for medical school and even nursing, with this competency-based medical education, this becomes a very good picture tool to teach. And if you look at this tool, you can see this is a tool where you can see this is a simple picture tool which shows the brain development, how baby should be given breastfeeding, how mother can do the massage, light massage, which a touch which is stimulated. This is going to stimulate the brain. Similarly, down you can see complementary feeding practices where baby can be given feeding at the same time play and communication. Look at this picture. This is a green color box. Look at this green color box. By 2 to 3 months, whenever baby comes to your OPD immunization clinic, you just look at these 3 milestones. Tell mother that this is how she should look at. She should look at the baby. Baby should recognize the mother's face, develop social smile, make eye contact. Then you can see the baby is raising the hand, raising the head, and you can see the baby is opening the hands. So these are the important milestones which are ticked in the green box. If all these 3 are okay, that means baby is in a green zone. That is normal. You also tell her what she should do. These are the parenting tips. You are teaching the mother You do this massage, use these toys, father should get involved. So these are the simple, important messages which can be given by anybody. Not, you don't require doctor, receptionists, nurses. Even I think your Aya Bai, who is in the sweeper, she is also will be able to do that. And I am very happy I have used it in the postnatal ward, even grandmothers and anybody who is there, they can understand in a very simple form. This is a red zone. If your baby is falling into this category, this needs early referral and detailed assessment for developmental delay. So look at this green box, then violet box and red box. So this is important thing. MCP card is a very good tool and it can be used up to 5 years. So you can use for first 1,000 days, that is first 2 years. All this is given it's available on public domain. So try to use, I'm using it in the medical college. I'm using it, I think I will just share my experience. Now, what is this first 1,000 days? You take care of women during pregnancy, before and during pregnancy, improve IYCF practices and have the good access to the health and nutrition. There is another program which is launched by Government of India. This is home-based young child care. Very important program. I think all MBBS doctor and nursing students, they should read this because our Ashas are doing. And I'm sure this will be very useful for all of you also. Look at this important milestone: first visit, second visit, third and fourth and fifth. Look at this picture. This is how your baby should be at 3 months, 6 months, 9 months, 12 months and 15 months. So simple one picture tool if you show, I think this gives a clear message to the mother, to the caretaker, to the doctor and everybody. So you know that your baby is developing normally, and this will also tell you whether the baby is growing well or not. This is a screening tool. I'm again telling you, this is not a diagnostic. Anything delay or deviation, you need to refer. This is how I am using in medical college. We usually have in the immunization clinic, our nurses, whenever the parents are waiting in our high risk OPD, our interns, they do it. Even antenatal mothers, we do this education in the antenatal clinic. Many times we find parents are sitting and reading, and there is good material developed by Government of Maharashtra in Marathi. So that can also be utilized. Postnatal ward, you can see all these nurses and doctors, physiotherapists, they also visit the mothers. So these are the opportunities for us to utilize all mother-child protection card as a communication tool. Is my project, which I am using my third year, the third MBBS students, 6th and 8th semester, and they find it very useful. Whenever we are teaching milestones, we use mother-child protection card. There are good messages. So you can see here, even grandmother is interested in listening to this thing. Even so, every mother who is going to be there for next 3 months, 3 days or 4 days, we can utilize these opportunities. And even I find many times in the pediatric ward, when mother is just sitting next to the baby, give her read, then nurse will help her to do that. Even father is started doing high risk, they also start talking to the baby. And father was so much interested. He made his room for the baby very colorful, and he showed different type of audios what he is using to stimulate this low birth weight baby. So this is how, if you teach the parents, definitely parent will have ownership, and our work will be less, and the burden will be less. As a pediatrician, I think let us give ownership to the parents, and that is what the early child development is. It is a mother empowerment, caretakers empowerment, community empowerment. Now center has launched, Government of India has launched this Palan 1000, that is Palan Poshan, nurturing care. This was national program which was launched in August. I think next year we are going to learn about all these things. Palan 1000, journey of first 1,000 days, what I talked, what science you are listening since morning. This will come in practice, and I'm sure all of you joined together is going to change the scenario. So there is going to be one parenting app which will give all those things what I spoke about till now, with a picture form and in the local languages, so that it will be easy for coaching parents, families and caregivers. This is under RBSK. So thank you very much. And I'm sure that my session is just to sensitize you, because going to be practice is going to be a continuous process. We continue to learn. Thank you. Happy learning. Thank you.
Thank you, Pramila ma'am, for a wonderful lecture. The next lecture is Safe Motherhood, Happy Motherhood by Dr. Sucheta Kinjawdekar ma'am. नाही वाचली तरी चालेल. Let me
मेहनत घेतली. एक सेकंड. सुचेता मॅमचं दिलेलं आहे का? I think that's okay. मॅमनी डाउनलोड केलंय का अजून? तेच ना, ते ऑटोमॅटिकली नाही होत.
म्हणजे पहिली स्लाइड नाहीये पण ही.
नाही का? तुमचं हे का? तुमचं CV का?
हा, म्हणजे
Screen
first-
sharing झालं का
first
पण?
line.
स्क्रीन शेअर झालं. स्क्रीन शेअर स्क्रीन शेअर झालं ना? हो, ठीक आहे. झालं नाही, हे आपल्याला दिसतंय पण तिथे लिंकला झालं का ते स्क्रीन शेअर द स्क्रीन म्हणावं लागेल
म्हणायला
त्याला.
लागतं.
ओके,
आपण
ओके,
तू
ओके.
त्याला बंद केलंय ना स्लाइड. दिस इज स्लाइड. 2 विंडोज ओपन आहेत. सो आधी शेअर द
शेअर
स्क्रीन
करू
करायला
मॅडम आणि मग फुल
पाहिजे.
स्क्रीन करूयात आपण.
राईट. शेअर करायला
त्याच्यात जायला लागला का? बंद करून घ्या. नाव शेअर. त्याला क्लोज करून टाकायला तिकडच्या
राहू दे, काही हरकत नाही. ते नाही येणार मध्ये.
स्लो नाही होणार.
नाही.
स्लाइड शो होईल ना.
सॉरी पण ते चालू आहे. याला मला मागे करता येईल ना? ठीक आहे. ओके.
We all know a healthy mother gives birth to a healthy child, and so a happy mother to a happy child. To put more light on how to take care of the mental well-being of mother and to know more about safe motherhood and happy motherhood, we have with us our next speaker, Dr. Sucheta Kinswadekar. Dr. Sucheta ma'am is a leading obstetrician in New Mumbai. She is an assessor in Manyata, a Foxy initiative, a Lakshya mentor, and also a Foxy UNICEF project coordinator. Managing high-risk mothers and high-risk babies and fetal ultrasound are her areas of interest in obstetrics. May I please request Dr. Sucheta ma'am to please come up to the podium. Thank you.
Thank you so much. Good afternoon, everybody. Dignitaries in front of me and students and my pediatrician colleagues and my friends from school days. So warm greetings to you all. As Pramila said that this workshop is for sensitization, but I'll say I got sensitized because of this workshop. It so happened that one day Pramila and me were talking about, some common areas of interest in the public health field. I'm obstetrician, gynecologist, and I also work in public health sector regarding safe motherhood. And when we are talking about this, Pramila said, why don't you join a Zoom meeting? We are doing an early childhood development workshop, and in that about 1,000 days we are speaking. So 270 days belong to you guys. So why don't you join? So I joined the meeting, and it was a preparatory meeting with Fatke madam and Raji and Dr. Upendra. And suddenly Fatke madam said, Sucheta, tu bolat ka naहीस हॅपी मदरहुड वर? आणि मग तो आदेशच म्हणायचा. मी बेसावतपणे हो म्हंटल, मी बोलते. आणि मग त्याच्यानंतर ऍज आय स्टार्टेड रीडिंग थिंकिंग आय सेड याच्यावर कोणाचंच काही काम नाहीये. सो देन आय टोल्ड प्रमिला, विल यू पार्डन मी त्या दिवशी फक्त येऊन सगळं वर्कशॉप अटेंड करते, म्हणजे या सगळ्यांसारखंच मागे बसून. पण फडके मॅडम म्हणाल्या नाही, तू बोल. Then I actually started, reading, deep diving, thinking. So hey, talk is a kind of, open thinking or thinking aloud about happy motherhood. We are working for safe motherhood so far, right from MD, post-MD days till today. And what is safe motherhood? We want our mothers to be safe at the end of delivery, intact. We want safe childbirth. We want very less of preventable mortality and morbidity of mother. We need to prevent that, what is preventable. And also we want to prevent early neonatal deaths, and we want to avoid stillbirth. So, and we are working towards this. Now, in this, where is the question of happiness? Why mothers and when mothers die in antenatal period? See, these are the graphs, and there are around 1/4 of the deaths happen in antepartum period, few in intrapartum, and few after birth. Similarly, neonatal deaths or mortalities, mostly many of them are preventable if appropriate intervention is done in antenatal period, few intrapartum, and few immediately after birth. So if we offer high quality antenatal care, it has a potential to directly affect antepartum deaths and reduce complications intra-delivery, intrapartum, and postpartum. And quality ANC prevents maternal deaths. This thing is proved beyond doubt. So identification of high-risk pregnancy, we need to identify all HRPs, high-risk pregnancy. What are high-risk pregnancies? Those pregnancies where it can eventually end up in maternal mortality. So we know preeclampsia, nutritional anemia, hemorrhages, all these things we need to detect during pregnancy. Recurrent pregnancy is one more thing which are enforced on our patients and lead into various pregnancy complications. So appropriate family planning counseling, appropriate diagnosis and detection of GTM, detecting CPD, cephalopelvic disproportion, identification and treatment of nutritional anemia, appropriate identification of infection, nutritional counseling, so on and so forth. And all these things probably are going to prevent maternal deaths. Similarly, screening and treatment of maternal infections, correct estimation of gestational age, and appropriate administration of antenatal corticosteroids for preterm births. Okay, identifications of condition leading to fetal distress, intrapartum distress, preventing prolonged labor, so on and so forth. And if we do this intervention, we are going to help our neonates. Again, safety point of view. What is antenatal care that we are doing? It's a systemic care of women during pregnancy to monitor and progress fetal growth. Remember, this is growth. All over in antenatal OPD, we are just focusing on growth, and we are not at all talking, considering, sensitizing, reading about development of child. This is what we have learned. This is what we are practicing, be it a private sector, be it a government sector. We also need to ascertain the well-being of mother and fetus. So all over, fetal heart acha hai, live baby hai, mother no BP. So absence of complications, we say all is well, and that's it. Now, in public sector as well as in private sector, continuous quality improvement and awareness, where we are now focusing to prevent all these preventable deaths. So safe motherhood is all about preventing things. And what we are teaching to doctors, young doctors, obstetricians, and staff, that we need to do all those labor room practices which are safe for staff as well as patients. They're effective, they're accessible, they're patient-centered. Every time they are performed in timely manner and equitable. So all these practices, if done appropriately, are going to help mortalities and promote safe delivery. Now, when it comes to safe and happy about mental health of a mother, this was the first thing which I actually found in a WHO program, Improving Early Childhood Development, WHO guideline. Now, these are the 4 components. I think rest 3 you are going to talk in the rest of the workshop. The last one is support maternal mental health. So for the first time in this guideline, someone is speaking about maternal mental health, which is important in early childhood development. Now, when I actually went in and saw these are the things which are listed under supporting and maternal mental health, and I went to all these documents and read, and what they are telling us, again, nowhere, nothing is written about mental health. Everyone is speaking about the same antenatal care which we are encompassing in safe maternal motherhood practices. So the aim is pregnancy well-being, normalcy of pregnancy. This is a screening opportunity for maternal health in general and treatment of disorders. What screenings we do? We screen for anemia, we screen for GDMs, we screen for HDP, that is hypertensive disorders of pregnancy, then asymptomatic bacteriuria. So this is a screening opportunity. Thyroid. So we utilize this opportunity and screen because all these have impact on maternal health as well as child health. Then we do nutritional interventions. This is all WHO guidelines speaking about. Dietary intervention, iron and folic acid, calcium supplement, that's all. It's not recommended zinc, micronutrient, B6, vitamin D, vitamin A, all these things are not recommended. Only in rigorous research context, they are recommended. They are not recommended in general. Okay. Protein supplements. I think people must have experience in private practice. Patients आपल्याला विचारतात डॉक्टर पावडर लिहून द्या, बिस्किट्स लिहून द्या, प्रोटीन्स लिहून द्या, but supplement protein is actually not advised. We need to take some extra time to enlighten them about their nutritional and dietary needs. Then maternal and fetal assessment, this is what is recommended. Preventive measures, and then interventions for common problems. So these are the domains which are listed in maternal health under ECD. Okay, intrapartum care, we are practicing this, and this is again mentioned. So delivering on mother's abdomen, yes, this is not very much known to all gynecologists. I think it is hardly practiced in 1% of total childbirths that baby is delivered in abdomen. Today I'm going to your labor room of the same medical college and seeing what's happening there. But if I ask any nurse, बाळाला कुठे डिलिव्हरी केल्यानंतर कुठे ठेवतात, तर प्रत्येक जण सांगतो ट्रे मध्ये. Nobody knows the concept of delivering on mother's abdomen, not rigorous drying, delayed cord clamping, which takes care of anemia even in newborn babies. Okay, and that helps in preventing PPH as well, delayed cord clamping. If baby is, of course, vigorous and crying, if limb baby, it's early cord clamping, everyone knows that. Then early breastfeeding. How early? As early as possible, immediately, even before cord clamping if possible. Not that every baby's mouth needs to be, suctioned and done, all those rituals are to be done and afterwards baby is fed. No, as early as possible. Early, I mean, we need to initiate breast crawl in each and every mother. So that early breastfeeding initiation is very important. Kangaroo care. Kangaroo care is not only for preterm and small babies. It needs to be there for each and every baby. And now I understand it is also important from point of view of ECD. We were doing it for early and good initiation of lactation, but again, it is important from point of view of ECD. So KMC is important for each and every baby. Early rooming in, I think that practice is gone already. सगळे बच्चूज एकत्र एका नर्सरी मध्ये ठेवायचे रात्रीच्या वेळेला, स्पेशली इट्स व्हेरी इझी फॉर नर्सेस टू फीड सप्लिमेंट to all babies. I hope and I pray and I'm sure that practice is gone, but as early as possible, mother has to be, baby has to be with the mother. So early rooming in, immediate rooming in is very, very essential. आणि आपल्या लक्ष्य गाईडलाईन्स मध्ये किंवा या सगळ्यामध्ये we insist NICU, लेबर रूम, PNC वॉर्ड हे सगळे जवळ पाहिजे. ग्राउंड फ्लोअरला NICU आणि चौथ्या मजल्यावर पेशंटची रूम, हाऊ फ्रिक्वेंटली शी इज गोइंग टू गो देअर फॉर लॅक्टेशन. सो ऑल दीज स्मॉल aspects are to be taken care of. So this intrapartum care is one useful thing, these guidelines even for ECD. So all these things are making childbirth safe, but now we need to look beyond safety, and that is to happiness, happy motherhood. Maternal mental health, does it really have an impact on early childhood development? These are the two possible theories which I found, saying that fetal programming, environmental influences during sensitive period, that is intrauterine as well as immediate extrauterine period, may alter development of fetus with long lasting effect of the offspring. And this is called as genetic programming or fetal programming. And then probable another mechanism is some epigenetic changes. Then what is so stressful in the pregnancy? Do you think pregnancy is a stressful condition in modern era? Yes. I do a private practice and see a mixed socio-economical and cultural people or mothers with me. But still in 90% of the patients and or the mothers, and in India, I think that is true everywhere, 90% of the pregnancies are unplanned pregnancies. There is no pregnancy by choice, but it is just by chance. And when mother is not really prepared, she is just transitioned from her own house to post-married life and yet to get settled into so many other emotional turmoils. The pregnancy is just, it just comes, you know, so she's not prepared. So that is one stressor. There is role confusion. So far, she was in the role of a daughter or a wife or whatever. And now suddenly there is a role shifting, turnover, and there is a lot of confusion. There is no clarity amongst role of a father, would-be father, mother, in-laws, mother, grandmother, so on and so forth. So this becomes another stressor for mother. There are a lot of unwarranted opinions. माझ्या प्रेग्नन्सीत असं असं झालं होतं, अमुक अमुक झालं होतं, म्हणजे everybody, you know, voices out all negative experiences with the mother. Plus आपली गुगल मावशी आहेत सगळं सांगण्यासाठी, अजून बाकीचे सगळे ओपिनियन्स. फायनान्शियल अनसर्टॅनिटीज, बाळ मोठं झाल्यावर काय, माझीच नोकरी पक्की नाहीये, वगैरे वगैरे. So lot of so many factors are there, and all these things, all these stressors lead to anxiety, maternal anxiety, various adjustment issues, because nobody, I mean, not every person can handle all these anxiety and all these stressors very well. So maladjustment issues are there, and this leads to dysthymic mood. Dysthymic म्हणजे थोडासा low, dysphoric म्हणजे high. So थोडासा low mood in the pregnancy, and eventually it may lead to depressive bouts. So this need not be a very much clinically diagnosed depression, but these stressors are going to affect mental health of our mothers. And now this maternal depressive disorders in general, I will say, I may not say depression or clinically diagnosed depression, but these things are going to affect baby. Now, known maternal depression, we know that the baby is susceptible to develop even childhood depression. So that is proved. Anxiety disorders in the baby or the child. Baby may have various developmental issues. Some non-specific delayed developmental problems may appear in these babies. These kids may have in later life, may have normal intellectual function development or may not have, but definitely some developmental issues these kids may face if mother has depressive disorders during pregnancy. And child temperament. I think pediatricians are aware what is child temperament, but for in general, for students, let me tell, temperament is a set of traits. You know, the kind of baby's personality, you can say, whether the child is playful, how child is going to react to the stranger, child is going to withdraw or approach. So child is easy to handle. So all these set of traits is called as child temperament. Now, temperament can be easy child or warm, easy to warm child, or a difficult child. Now, difficult child temperament, if child has a, I mean, child belongs to that particular thing, that child probably will be having more of autistic and other traits as child grows. The easy to warm ones probably may have ADHD and some other behavioral problems. And the easy child is, of course, will be probably having least of co-mental morbidities. So child temperament in future is going for a child to shape into that particular child's personality. So moral of the story, maternal mental health eventually can have some or the other effect on the baby. There are various risk factors for maternal depression or depressive disorders: exposure to violence, especially intimate partner violence, war and disasters, food insecurity and famine, lack of sanitation, and lack of accessible quality health service. Probably in the very low socioeconomic status, many of these factors, they act together. Now, having said all this, how we obstetricians can help kids? मगाशी कोणीतरी म्हटलं, अरे आमच्या आयुष्यातली तर मुलं लहान असतानाची वेळ तर गेली, आता काय? अजून बरेच जण आहेत which can help their kids. But nevertheless, when now patient comes to me probably, and that's why I said this workshop has made me deep dive and think a little more about all these ECD and sensitize me. Now, henceforth, in my OPD, what I need to do, spend extra 2 minutes for some mental markers. खूप पेशंट्स आम्हाला सांगतात इथे दुखतंय तिथे दुखतंय, आपण म्हणतो अरे काही नाहीये, नॉर्मल काही नाही, फंक्शनल आहे, सो लिव्ह इट. सो नाउ आय नो इफ फंक्शनल आहे, सो आय नीड टू गो बॅक अँड आस्क अबाउट हर फॅमिली हिस्ट्री, और नॉट हिस्ट्री but some more background, and allow that patient to voice out what she wants to say. Then sleep, loss of appetite, change sleeping pattern, quality of mood or low mood bouts, lack of interest in previously pleasurable activities, ideas of helplessness, hopelessness, हे सगळ्या ज्या गोष्टी आहेत, I need to give some time, ask that patient and assess at what spectrum she belongs to. Okay, intimate partner violence, yes, of course, and we need to have that special tactics to ask about this. Mild issues or mild depressive disorder, I think we need to treat them with empathy and non-judgmental eyes, reassure about current issues, involve her partner and family managing all these, few relaxation techniques, mindfulness, giving suggestions. So all these things are going to help in mild depressive disorders, and moderate and severe, we need not hesitate to get a professional help for these patients. Educate the patient about need to safeguard and protect their mental health during pregnancy. Medication or antidepressants are only reserved for severe diagnosed case of clinical depression and not all. I have not included diagnosed major psychological illnesses in this mother. I'm talking about mothers in general in community. Some strategies that I came across while reading all this was psychoeducation, cognitive behavior therapy, interpersonal psychotherapy, and other non-specific strategies like participatory learning, social support, some kind of fun activities, aerobic exercise, kangaroo care, and music therapy, and so on and so forth. No, I actually urge to our health specialists in the field to find out and to formulate some good strategies to help our mothers and to improve their mental health. And this can be done along with the help of obstetricians and mental health consultants in our fraternity. Thank you so much. Thank you, madam.
Excellent and very you really helped us to think beyond the conventional approaches what we do. Thank you. I think this is need of an hour when we see, and I will bring the perspective of those mothers who come from deprivation. They don't have anything to really look forward, and I think this really you have brought out those issues that has been missed out or maybe ignorant about. Thank you so much.
Thank you, ma'am. Just one moment. I would request Dr. Ravindra Sonone, sir.
Dr. Sucheta, because you made it so simple. You know that little 2 minutes extra can make a lot of difference.
I would request Dr. Ravindra Sonone, sir, to please felicitate Dr. Sucheta, ma'am. Dr. Sucheta, ma'am, please one moment. We all know that healthy development in the early years provides the building blocks not only for educational achievement, but also for economic productivity and more so ever successful parenting of the next generation. During this incredibly important period, to ensure that children have a strong foundation for future development, let us know from our next speaker, Dr. Upendra Kiljarekar, President-elect CIP 2023. Sir, may I please request you?
स्क्रॉल करावं लागलंय.
Full screen, full screen आहे ना, full screen.
सर शेअर स्क्रीन झाला ना, शेअर स्क्रीन झालं,
त्याच्या बाजूला
स्लाइड शो झाला इथे खाली.
तोपर्यंत मी एक रिक्वेस्ट करतो की फडके मॅडम यांनी बोधनकर सरांचा मोमेंटो देऊन सत्कार करावा.
स्क्रीन आहे ना सर तुमचं,
इंट्रोडक्शन आणि रिस्पॉन्स.
मी राजी नायर मॅडम यांना रिक्वेस्ट करतो की प्रमिला मेनन मॅडम यांचा मोमेंटो देऊन सत्कार करावा. तिकडे
इंट्रोडक्शन टू नर्सरी केअर नंतर होते सर.
पुढचं
So good afternoon, friends. So now we are back to our module on early childhood development. So are there any private practitioners, pediatricians here? Yeah. But nahi, tumhe nahi sir. Guruvarya tumhe. So we have, I think now we have come to our module of Indian Academy of Pediatrics. So this was a flagship program which was launched in 2021 by then President Dr. Piyush Gupta in collaboration with WHO, UNICEF and all the world organizations. Basically, last couple of years, the entire focus of world is changing. And what is it changing towards is the healthy development of a child. Development, apan shabda ko peda hai to. Each one of you sitting over here is cherishing an unfulfilled dream in your heart. And it is common to each one of us. And what is it? All of us want to see India as a developed nation. We have, since I have born, so we have been listening, developing country. Ami kati developed madhe jana. So one of the major focus, major factor, which was hindering our progress, tumse health parameters dakwa, tumse developmental quotient dakwa, tumse adult earning capacity dakwa, well-being dakwa. Sagalya madhe ami gappa. So that was a major factor. And now it's high time that we want to go ahead, move ahead and become a developed nation. And for a good child development, what is very important, single most factor that is required is, and which all of us can contribute in some ways, if a pregnancy ends at 40 weeks with a 3.5 kg baby who cries immediately after birth, who is put to mother's abdomen immediately after birth, who is exclusively breastfed for 6 months, who gets timely introduction of complementary feeding, whose growth is monitored, and who has been applied with all the domains of early childhood, why not? This is the single most cost-effective intervention which can immediately take us to that category. All these are so simple interventions, but everywhere there is a problem. So 40 weeker, 3.5 kg, I consider that's my wife's and the obstetrician's domain. But what about after that? We cannot give any answers for that. So I think that onus is on us and each one of us. You could be tomorrow becoming general practitioners, you could be physicians, wherever you are. I think let us all put our efforts. So with this same dream in mind, so this is all, entire world is focusing toward early childhood development. Second very important part is today morning also you must have seen the brain development, brain architecture. Why these 1,000 days? Why these 2-3 years matter the most? Very important to understand the development which is happening. So almost 30% of brain growth is over by the time the baby is born. 30%. So by the time you're 2 and 5 years old, your 50 and 80% is done. त्याच्या पुढे चेंज करून it's extremely difficult, point of no return. Stunting, madam was asking you, 2 years काय होते तुमची height? Why? Because the stunting cannot be reversed after 2 years. तर तुम्ही का करत नाही? जन्माला आल्यापासून फक्त वेट मॉनिटरिंग का? हाईट करायला, लेंथ करायला काय प्रॉब्लेम आहे? वेट टू लेंथ चार्ट प्लॉट करायला काय प्रॉब्लेम आहे? टाइमली इंटरव्हेन्शन करायला व्हॉट इज स्टॉपिंग यू? So I think these are the second that is very important, that brain architecture, very rapid growth, 100 million synaptic connections happening every second in these 3 years, which imagine 100 million were 1,000. After 2 to 3 years, it is only 1,000 synaptic connections. So the baby can learn anything, everything. And that's where if I take to extreme, other extreme, I completely neglect that child. I completely maltreat that child. Imagine what would happen. The same way it would have other adverse outcome. The same way that I was saying that if you do this nourish, that plant is going to grow into wonderful tree. And hazer me killer, neglect killer, maltreatment killer, abuse killer. So it is again equally damaging. So that is termed as toxic stress. Very important pointer. Some stress is all right. Every one of us has some stress, which is positive. Today, adrenaline, cortisol release, like what it doesn't actually makes us warm. It's fine. Moderate. Sometimes it is okay. But when it goes to toxic level, again, point of no return. कारण काय होतं, neuronal architectures gets completely hampered. Neurotransmitters get completely disarranged. And that is how the child's further development stops. So please be careful whenever you are dealing. And that's why these 3 years matter the most, the first 1,000 days. So that's why we have to, the first 270 days, nantar se 2 varsha. Of course, this is flexible. Some say after up to 3 years, some say 4 to 6 years, 6 to 8 years. It's all right. So WHO parameters, काही जण 6 वर्ष पण म्हणतात. But the point is, early, these years are so important, that domain. And which are the pointers that we are taking care of this? So these are the domains of early childhood development, nurturing care. What are they? It's health. Good health is very important. Today, what is a pediatrician doing? In my practice, what kind of health service that I'm providing to my patients? Number one, acute sick patients, they come to me, they get treated, they get better. That is about 80-90%. In fact, all the practice is happening that. Number two, what is the other preventive strategy that you are adopting, Dr. Upendra, in your clinic? Vaccination. What else? Do you talk about, nutrition advice? I do give sometimes. I talk about complementary feeding. I talk about balanced diet. What else? Gappa, kahi nahi. So acute sickness care, some vaccination, of course, now it is going down from our domain going to government, and some little bit of nutritional advice. That's it. Tachapude kais nahi. So that is how we have to grow one step higher and talk about these health practices. So that's very important. Nutrition. How many of us, we talk about exclusive breastfeeding, tari they kill the number of prescriptions of tins on day one of after LSCS are not ready to come down. 40% are LSCS rate of sale, 60 to 70% of these babies get tin. Even in city of Nashik, let me tell you, one of my very close friend delivered, had a grandson just 2 days ago, and first day after LSCS, tins of prescription dilo hoto. Very sorry state of affairs. So this is what is happening. Why are we doing it? Because I do not have time to spend, and I cannot train my staff to talk about how breastfeeding is important. That is number 2. So nutrition, 6 months complementary feeding. Do you know rates? What are the rates? 10% of our people, 90% of our childhood population doesn't get the adequate diet, the variety of diet. They do not get it. So this is what is happening. Why? Because I don't have time. The 6th month visit is so important. It is not only for that complementary feeding. They do come to us for flu shot. But then Samir is sitting here. All the developmental deviations, we can pick them up at 6 months. कसं नाही लक्षात येत. 1 वर्षापर्यंत तरी लक्षात यायला पाहिजे. अरे हाक मारली बाळ वळून बघत नाही. Why? त्याला ऐकू येत नाही हे तरी लक्षात येऊ द्या आधी सगळ्यात पहिली गोष्ट. So these are the ways that unless I interact, and if you don't enjoy your 6th month child visit, there is something wrong. आय एम लुकिंग फॉरवर्ड. 6 महिन्याच्या फ्लू शॉटला जेव्हा बाळ माझ्यासमोर बसतं, दॅट्स अ स्ट्रेस बस्टर फॉर मी. आधीचे 5-7 पेशंट कुठले तरी सिक पेशंट आलेले असतील, 6व्या मला काय करायचंय, फ्लू शॉट इज नथिंग, तेव्हा मला कॉम्प्लिमेंटरी फीडिंग बद्दल बोलायचंय, मला इंटरॅक्ट करायचंय. आय कॅन सी द अटॅचमेंट व्हॉट इज हॅपनिंग टू द फॅमिली विथ द पेरेंट्स. हे सगळं जर मी त्या 6 महिन्याच्या व्हिजिटमध्ये इफ कॅनॉट डू इट, what's the point? So that's why nutrition we need to be very careful about. Safety and security. What are we talking about? What safety and security are we providing? So we talk about maybe safe. The rest of the things are government's domain. They have to provide safe roads. They have to provide playgrounds. आपण सगळं गव्हर्नमेंटमध्ये नाही घालू शकत. Certain situations, common poisonings, how home atmosphere can be safe. How किती जणांकडे म्हणजे चहाचं कप काय झालं, कसं ठेवलं होतं, नाही बसलो तो वरती होता गरम चहा आणि मी नुसती अशी वळले आणि बाळांना चहाचं कप आणि द बेबी गेट सिव्हिअर बर्न्स. इतकं शिजलेलं ते भाताचं भांड पातेलं तिथे तुम्ही कडेला ठेवूच कसे शकता, पण हे नाही माहितीये पेशंट्सना. आय एम सॉरी. आणि हे सगळं सांगण्याची गरज आपण करायची गरज आहे. सो दॅट्स वाय सेफ्टी अँड सिक्युरिटी मॅटर्स देअर. एव्हरी टाइम यू कॅनॉट पास द बक टू द गव्हर्नमेंट. अर्ली लर्निंग अपॉर्च्युनिटी. अर्ली म्हणजे किती अर्ली? डिलिव्हरी झाल्यापासून opportunities are there. You just take the baby. Every member of the family has to just talk to the baby. Eye to eye contact, smile, do anything. आणि प्रत्येक मेंबरची ही जबाबदारी आहे, फक्त आई वडिलांची नाही. सो व्हेरी इम्पॉर्टंट पॉइंट विच हॅज बीन शोन दॅट फॉर फायनल गुड आउटकम एज गुड इंडिव्हिज्युअल, a safe, secured attachment to at least one caregiver is so important. So if it is not so, तरी आपण सगळे काहीतरी करू शकतो. मी मगाशी इनॉग्रेशन मध्ये बोललो, फ्लाईट मध्ये रेल्वेत तुम्ही तुमच्या पुढच्या बाळाशी 2 मिनिटं खेळू शकता. हू नोज दॅट चाइल्ड इज डिप्राइव्ड ऑफ दॅट गुड अटॅचमेंट समवेअर बट गेट समथिंग फ्रॉम यू. व्हाय नॉट थिंक अबाउट दॅट, की मी काहीतरी 2 मिनिटं 5 मिनिटं त्या बाळाशी छान खेळले. सो दॅट विल गिव्ह यू अ पॉझिटिव्ह feeling for you and gives that early learning opportunities. Reading, it has been found we have no results. If you ask people what are the rates of reading books to the children, we have no figures with us. So that is how, if we can concentrate our efforts on such domains in great details, I'm sure we can do wonders to these children. So this is what is it all about. I'm not again going to go into all these slides. So this is how we are talking about parental illness. Madam has already talked so wonderfully about mental health and how they are going to concentrate more on that. These are the SDG goals. And what is it? The neonatal mortality rate. Do you know what is that we are planning to have by 2030? What we have promised? 12. So 12, there are about 63 countries. Unfortunately, we are also one of them who are deviating. And now, in fact, Modi ji, you know, he gave us the target of no TB, zero TB in India by 2030. He has reduced it to 2025. Same thing happened just 2 days ago. Day before yesterday, I was in National Neonatology Forum and Dr. Vinod Paul, our Niti Aayog person, he said, sir, ani sangitlay ki neonatal mortality now we don't want it to 2030. Why not till 28? So neonatal mortality, bringing it to single digit, it's a great thing that would be achieved by us. But for that, all of us need to put efforts. We want to see not only the health, learning, psychological development. So we are not talking about generally what is the definition that we do of growth and development. So growth, we say that it's a quantitative and development is qualitative. But ithe, when you talk about ECD, they all merge. So it all becomes, so it is a generic term. And what we talk about health is physical, mental, social well-being, not only absence of disease and infirmity, but here what we are adding is cognition. We are talking about learning. And third very important parameter is we are talking about emotions. We never discuss this. We never talk about this. And these are the parameters which are going to shape that individual's future. We are very sorry, all of us have felt the shocking way in which incident, ghastly murder which took place in Delhi. Why would this happen? Somewhere down the line, somewhere in the past, that person probably did not get all these parameters. That's why deviated completely and that kind of personality. So if we want a safe and socially secure atmosphere for our women in the country, we need to put efforts on all the boys in ECD, every parameter of it. So this is what we are going to discuss about this. This is and the return of investment. Can you imagine? सध्या काय एफडीचा रेट किती आहे सोनावणे सर? एफडी 6.5. बघा सगळ्यांच्या फिगर्स रेडी आहेत. डू यू नो द रेट ऑफ रिटर्न ऑन इन्व्हेस्टमेंट ऑन दिस ECD? 17% it is considered. So every dollar that you spend, you get $17 in return. That's huge. And how many children are deviating from this? You know the figures, it's about 250 million children. That means 43% of children do not get it. If you talk about India, about 60% of them. There are two most important adversities, and that is one is poverty and second is stunting. Extreme poverty and stunting, solely the other two parameters which are modifiable is parents' education and maltreatment. If children do not get it, and if they get it, it rises to 75%. So out of 4 children, 3 children will not develop to their complete potential. ह्याचा complete aim काय आहे ह्याचा? Health and well-being फक्त नाहीये. To achieve optimum potential, तुम्ही 18 वर्षाचे व्हाल तेव्हा असे सक्षम सजग नागरिक व्हाल या देशाचे की तुम्ही हा बोजा पुढे सहज उभारू शकता तुम्ही पुढच्या जनरेशनला. That is very important. It is not only these children, their NCTs will reduce or something like that. But when they become parents, it has been found that they become good parents. And that is what we want. This is to be continued. So this is what we have talked about. We have talked about brain development. We know about this. Certain factors, सगळं gene नाहीये. So there are certain biological sicknesses होतात, demographic. आज तुम्ही युक्रेनमध्ये जन्म घेतलात या क्षणी, I consider, yes, it's an adversity. There, all these domains may not be able to be applied to those children. So that's fine. But then we in fact, empathize with them. But at the same time, not in India. We're in a safe situation. Social, the father is complete drug addicted or alcoholic. He's maltreating the entire family. Environment, pollutions, these are so many other things. But then whatever is under our control, we must work on that. So this is what we are talking about. This is what the figures are. And this is what. So what is this module is, in short, I would say, first and foremost, it improves your communication skills with the patients. That's very important. And that's so essential. If you want to become successful practitioner or successful human being in any domain, you physician, ophthalmologist, bank manager, अजून काय व्हायचं असेल, communication skill is the most important point. I feel that if one person has to be successful. So this tells you about that. It gives you an opportunity to impart these knowledge and skills to the parents sitting in front of you, so that you are empowering them. तुम्ही तुमच्या बाळाची किंवा मगाशी यांनी म्हटल्याप्रमाणे आपण सगळे मिळून. Third is you have to monitor the growth. So plotting the growth, that's so important. Deviations from normals, that is to be seen, and mental health of the mother. So if these are the 5-6 key focus area, objectives of this ECD, and if we apply each one of them properly, and then we widen the circle. So we sitting over here, then the parents, then the extended family, the aji azubas, the kaka maushis, atyas, they are there, the community, neighbors, where you're, the schools, the teachers. And then you can tell government, नाही आता असं नाही, एवढी प्लेग्राऊंड करा, खेळायला मुलांना नाही, आम्ही वाचायला सांगतो, लायब्ररीच नाहीये. मग तेव्हा तुम्ही म्हणा ना, पण तुम्ही आधी तुमच्या 5 गोष्टी करा, तेव्हा त्या 6ला बोलण्याचा तुम्हाला अधिकार होतो. लायब्ररी नाही म्हणून तिथेच रडत बसलं, मग हाऊ कॅन आय रीड बुक्स टू द चिल्ड्रन? No, that's not done. So let's go one step at time and then widen number 4. So this is what other factors which are affecting, but then we are going to focus and control those which are under our control. So this is 5 guiding principles: child's right to survive, leave no child behind, family centered. So this entire module is on that, whole of government action and society. So everybody, it takes a village to raise the child. असं म्हणतात, एकच माणसाचं नसतं, तो फक्त आई वडिलांचं बाळ नसतं, entire village. So everybody puts in their efforts and the child grows and develops. So it also takes one man to raise one village. Yes. Like you. So lead and invest. So this is IIP's nurture programs, focus on families, strengthening services. Of course, we want to monitor progress, use data and innovate on this. So this is a political legal wheel, which is there of optimal duration. And these are healthcare visits. So इतक्या सोप्या केल्या आहेत, कशा आहेत बघा. Every time you don't have to call the family for any special visit. पहिली 7 दिवसाला डिस्चार्ज झाल्यानंतर 7 दिवसाची visit is so important. If on 7th day the lactation is not established, झाले वाट लागली, टॉप फिडिंग इज सर्टन. आणि जर तुम्ही त्या दिवशी बघितलं असेल की येस मदर इज एक्स्ट्रीमली हॅपी, सॅटिस्फाईड, छान त्यांचा बॉन्ड तयार झालेला आहे, देन यू हॅव डन, देन पुढे बघायलाच लागत नाही. इट्स ऑन ऑटो मोड. काय मोठं रॉकेट सायन्स नाहीये ब्रेस्ट फिडिंग. ऑल द अदर एनिमल्स ऑल्सो डू. आपणच का नाही? आमचे डॉक्टर हेमंत जोशी कायमच म्हणतात तशा गोष्टीच आहे की तुम्ही कुठल्या तरी कुत्रीला, बकरीला, वाघिणीला, हत्तीला, कुणाला बघितलंय दुसऱ्याचं दूध पाजताना? माणूसच का? वी हॅव नो आन्सर टू दॅट, बिकॉज मला वेळ नाही आणि डबा लिहिणं सोपं आहे. is it that excuse? So I think that is very important. So that is 7 days. तेव्हा तुम्ही jaundice आणि बाकीच्या गोष्टी पण बघू शकता. Then 6, 10, 14 are the visits for which they come for the vaccination. Then comes the 6-month visit, again for vaccination, as I said. Then 12 months, 18 months, 24, 30 and 36. So barring last 2 जेव्हा आपण vaccination नसतं, rest of all the visits are there planned that they can be done together with your vaccination session. Spend, as madam said, she's going to spend 2 minutes extra here also, just, and it's not, I cannot do it every time. Now post COVID, all OPDs of hundreds, those who had, has also come down. Fortunately, unfortunately, we have been given opportunity to interact more and empower your frontline staff. तुमचे receptionist staff कुणाला दोघांना तिघांना तयार करा ना. So very happy, and there also they learn very nice. They also feel they are doing something. Sir, याला ना हाक मारली तरी वळून बघत नाही. बघा ना, मला ऐकायला येतं असं वाटतंय पण तरी तो बघत नाही. म्हणजे काहीतरी रॉंग आहे. एवढं तिने सांगितलं मला आत येऊन, more than happy. What more do I need? ते आई वडील काहीतरी हा मुलगा लक्षच देत नाहीत आणि हे तिघेही जण कंटिन्युअस बाहेर बसले होते. तिघांचे स्क्रीन कंटिन्युअस चालू होता. इफ शी कम्स अँड रिपोर्ट्स बॅक टू मी, व्हॉट मोर डू आय वॉन्ट? सो दिस इज हाऊ वी कॅन एम्पॉवर. अगदी तुमची ती आया मावशी असेल हॉस्पिटलची जी साफ करते, तिच्याही हे सांगितलं 4 गोष्टी तरी लक्षात येतात. The MCP card is such a brilliant thing which government has done. Unfortunately, we don't have time to talk to patients about it. So this is how we are going to discuss this. So this is Mother and Child Preventive Promoting Health Services. And this is done everywhere, but IIP is the only organization, and India is the only country where more than 200 workshops of this level are. The dream is to train about 10,000 pediatricians. And नुसतं तेवढंच नाही, it is expected that they go and practice in their respective areas. So this is how we are going to go about it. So it's basically integration of various domains that we talked about. So now just a couple of questions, open-ended questions to you. So do you think there has been change in profile of concerns voiced by patients? So even if you are a final year resident, you can just get up. If you've done a pediatric OPD even once, that is good enough. Do you feel patients, the kind of questions they come and ask, anybody can just get up and say, is there anything that you felt that questions are changing? Do they ask only about bukhar, sardi, khasi, or when they come for vaccination, have the questions changed a little bit? Does anybody come and ask, Dr. Khaila kai deu? Does anybody come and ask, Dr. खूप जास्त हा टीव्ही वर असतो? Does anybody come and ask, Dr. हा अजिबात खेळत नाही, काही नाही, त्याचं लक्ष नसतं, याला बाकी कशाची आवड नाही? So these are all the questions which patients have also started coming. Unfortunately, we always felt that Google Maushi, as madam was talking about, gives all the answers, but it is not so. You put any question and millions of sites open there, which one to consider authentic, and this is really a good information. It's difficult for patients. So do you think nurturing care will help? What is your general opinion? Is this good? Yes. Are these not the front benchers? Anyone who has done, who is doing internship, anybody here? अगं हे नाही सोडून बाकीचं चाललंय माझ्या मागे. कोणी इंटर्नशिप चौथ्या लाईनच्या पुढे इंटर्न कोणी आहेत? प्रिलिम झाली आहे तुमचं, काही नाही, टेन्शन घेऊ नका. So interns, yeah, have you done pediatric OPD? Oh, she's playing very safe, huh?
No, they are posted in ward and NISO.
तुम्ही घ्या सर, त्यांची बाजू घ्या. Okay, so good. So this is the way. Sir, thank you, Bhakta. So I think this is what the 5 domains of, and this is what general overview you consider that introduction. So all this thing was one in all. So I'm sure that at least somewhere you have felt that the ECD domains are important and everybody can contribute in their bit so that the child develops into a great human being. Thank you so much. मी परत येईन.
उपेंद्र किंजवटकर सर, थँक्यू. आणि खूप छान पद्धतीने, म्हणजे मराठीत आणि इंग्लिश याचं इतकं चांगलं कॉम्बिनेशन मी कधी बघितलं नव्हतं. आणि मी पण एवढ्या, मला साई वर्कशॉपचा मी विचार करत असताना ते पूर्ण क्लाउड माझे निघाले आणि मी पूर्ण कॉन्सन्ट्रेट करून सरांचं लेक्चर ऐकलं. Thank you, sir. Thank you very much.
Thank you, sir. Thank you, sir. May I please request Dr. Ravi sir to felicitate Upendra sir. Sir, please. Our next topic is good health, growth monitoring and screening of parents. And as speaker, we have Dr. Anand Deshpande. He is a consultant pediatrician and neonatologist at Dinanath Mangeshkar Hospital, Pune. He has been an ex-associate professor at BJ Medical College and a PG teacher since last 25 years. He also has been the past president of IIP Pune and executive board member of CIIP 2019-2021 and has organized several national and international and state level conferences. May I please request Dr. Anand sir to take over.
Growth monitoring, बरोबर. Slide show. तर ह्याचं मॉडेल तर ना पुढचं दिसतं असं एक असतं पुढची स्लाइड दिसते हा पुढची स्लाइड दिसली पाहिजे असं एक असतं ना नाही ऑप्शन तसं नेक्स्ट स्लाइड कुठली हा हे छोटं इथे मग करता येईल तर नाही तसं नाही तसं नसतं तुझ्याकडे नाही येत ठीक आहे हॅलो आली की पीपीटी हो पीपीटीच आहे this is mainly students. You are basically from third MBBS, na final MBBS. Final when you are going for final exams, January end. So this is quite useful for you, especially this presentation, which is growth monitoring, and it is direct exam orientation also, and this is helpful in day-to-day practice also, for the practitioners as well as for the students. So listen carefully. So Dr. Kinjavadekar has covered everything very nicely and beautifully. He has touched all the aspects of 5 components of the ECD. Now we are going to considering the health component. So what are the learning objective of this presentation? At the end of this section, the participant should define health in the context of ECD. Then enumerate the promotive and preventive healthcare practices related to the good health that need to be universally practiced in a well child visits. To be motivated to perform growth monitoring in every child, know how to elicit parental stress. These are the aims of our presentation. And health, and now everybody has learned in PSM right from my third MBBS days, maybe 35 years back. Health has been defined as a complete state of physical, mental, social well-being, not merely the absence of disease and infirmity. We learn this in the PSM and leave it in the PSM. In practice, we always become a disease treater. We keep on treating disease. We are not bothered about the health. Most of the practitioners boast about how much disease I have treated, how complicated cases I have treated, but we forget about the health. And making our patient more healthy is one of the major tasks of a physician or a doctor that everybody forgets and keeps behind treating the disease. So ECD is the module which is not to be forgotten here. It is to be taken back to your practice. That is the crux of it. Other modules you can learn and forget if they are not applicable. This is completely applicable to your day-to-day practice, and your approach has to change after the ECD. So fundamental health is a fundamental human right to attain highest standard of health. And millions of young children do not reach their full developmental potential Because of what? Poor healthcare, inadequate nutrition, lapses in safety and security, poor stimulation, and limited opportunity for the early learning. So you know that there is nature and there is nurture. Nature is that is genes that has been given to you by your father, mother, and what has come to your genetic makeup. By nurturing, you improve that. And if you don't get nurturing properly, then there will be no full exploitation of the genetic, whatever genetic strength you have. And in early childhood development, by touching all these three things, we want 5 things. We want to have the complete expression of your genetic potential. Exposure to the chronic state of stress and resultant flight response has a detrimental effect on physical, mental, and social health of the child. Healthcare services. There are promotive, preventive, curative, rehabilitative, and palliative. What are the promotive healthcare services? Anybody? Students, promotive healthcare services. You know it. Promotive healthcare is something that you promote for the health. Breastfeeding. Breastfeeding is a promotive health service. And sanitization, water and hand sanitization, and these are the promotive. This will prevent the disease. So we hardly wash technique, we call it water and sanitary hygiene. And this is a promotive. Then preventive is, you know, that immunization is a preventive. Curative is what we day-to-day do in our OPDs. Rehabilitative means the person has suffered the disease, we want to rehabilitate. And palliative means there are terminal diseases, there are diseases which don't have any cure. You keep on do a palliation. These are the health services we offer to our patients. But most of the practitioners, what we do more of the curative services. We give more of the curative treatment, and some of the practices we do are the preventive, that is immunization, as Upendra has touched upon it. We encourage some breastfeeding and other practices, but we are not up to the mark in promotive services. We are not up to the mark in preventive services. Whatever 80% services what we render in our practices are only curative. That has to change. Good health is attainable when caregivers seek appropriate curative health care and for acute and chronic illnesses, are aware of a children's physical, developmental, and emotional status, give affectionate and appropriate response to the child's daily needs, protect young children from household and environmental dangers, practice hygiene practices which minimize infections, use promotive and preventive health services. So these are again this repetition of the same thing. Promotive breastfeeding support, which is not utilized or underutilized. IYCF counseling not utilized up to the mark. Wash technique, we don't advise much about the health hygiene, water and sanitary hygiene. That is underutilized by us. Then immunization, we do immunization. Growth monitoring, some of us do growth monitoring, not everybody does growth monitoring. Nowadays, because of the lot of endocrinologists, Dr. like Vaman Khadlikar, and they are been teaching us for years together, many people have started monitoring the growth. But then also, not everybody is monitoring the growth. Growth monitoring is one thing that will identify the disease at the earliest. Developmental monitoring also we are not utilizing properly. Curative services we are giving very properly, and that is our main component of our day-to-day practice. So growth monitoring, why it is important, not universally practiced by all. NFHS 4, this is a data, NFHS 4 data. Thereafter there is an NFHS 5 also has been released. It tells that there is a stunting of 38.4%. Do you understand what is stunting? No understanding, students? Stunting, is related to what? Height or weight? That is enough. Then wasting. What is a wasting? What is a wasting? Severe wasting, and what is underweight? It is related to weight or height? Weight. So this is a grading. Underweight is a milder one. Severe wasting and severe wasting. So difference of a standard of deviation. So it is these are the grades, but they are telling the same thing. And these are the data available. Wasting is 21%, severe wasting 7.5%, underweight 35.8%, stunting 38.4%. So these are the pathetic figures, and that's why our name again and again comes in the hidden hunger, and India is topping at this level, and 107 in 120 nations, like that, because of this, and we want to improve on that. Children and adolescent increase at the same time. Ours is a country which has various paradoxes. So at one end we are having severe malnutrition. At the other end, at the same time, we are having a large population with obesity, and the obesity, childhood obesity, is also becoming a significant problem. So our aim of growth monitoring is to identify trajectories of normal, faltering, or abnormal growth using age and sex appropriate WHO charts. So in ECD, we have total 11 visit, and for 11 visit, we are doing weight, length when appropriate, height is after, we call it as a height after 2 years, and below that we call it as a length. So every visit we are going to get length or height, head circumference, and mid-arm circumference. Mid-arm circumference, everybody knows. Mid-arm circumference, what is the importance? There will be short note on that. Mid-arm circumference. So do read if you are not read about it. So what are the indicators for the referral? What are the things that you have monitored growth? Now you should know what is problematic growth and when we should refer to a specialist. So weight loss or lack of weight gain in 2 consecutive visits. Weight, length or height or head circumference, any of them, less than 3rd centile. Weight, length or height or head circumference more than 97 centile, because at the same time we have stunting and wasting, we also have obesity in some of our populations. So any weight more than 97 centile is also a problem. Crossing 2 major centile lines, upwards or downwards. So you are seeing the centile lines there. So if there is a crossing downwards or upwards by 2 lines, then that both is to be taken cognizance of. So in COVID times, there was crossing of 2 lines upwards in the children. The children, because sitting home, not playing at all, had a weight gain of about 20 kg in a year or 1.5 years, 20 kg weight gain. They started suffering from diabetes. Adolescents started suffering from diabetes, hypertension. And so previously we had a habit to see the centiles going down, but COVID gave us the habit to see the centiles going up also. 10 to 20%. And mainly adolescent, 9-10 year onwards. So overlooked health issues. What are the overlooked health issues? National Health Portal. What is the prevalence of birth defect? 1.7 million annually. In India, we have 1.7 million annually birth defects. Congenital hearing loss, bilateral 1 to 5 per 1,000 live births. Unilateral 8 per 1,000 live births. Prevalence of childhood blindness 0.6 to 1.6 per 1,000. Visual impairment 2.05 to 13.6 per 1,000. Community-based data for young children unavailable. Prevalence of dental caries 2 to 5 years old 48.9%. And wash intervention, that is hygiene intervention, prevents 3% of under 5% mortality. If you teach parents how to prepare the feeds properly, how to wash their hands while preparing the milk or food. That is going to save 3% under 5 mortality. And parental stress is a quite common. No data is available and has a major impact on ECD. So what should be added universally? So to do neonatal screening for external birth defects and hearing screening. Many hospitals now do the hearing screening at birth, and that is called as OAE, autoacoustic emission technique. And screening for the visual problem in infants and toddlers can be done. It doesn't require any separate machine, and that can be done by anybody. It can screen for ocular defects, problems in alignment like squint and red reflex, screening of orodental hygiene, counseling regarding personal hygiene practices, physical activity and sleep hygiene and screen time, eliciting parental stress and contributing the risk factors. This is the most important thing. This has to be done in any baby that is discharged from your hospital, or you have seen and it is getting discharged from under your care. You should be doing it. This is a red reflex or fundal reflex. Assess in dim, dark room, sitting 1.5 feet away. Allowed 10-second waiting time for the pupils to dilate. Infant placed in lap or shoulder facing backwards. Set the ophthalmoscope lens power 0. Look through the instrument so that the entire face of the child is clearly focused and light projects onto the both eyes simultaneously. View reflection in both eyes individually and together. This is done in my hospital for years together, and the person is trained, one person is trained for that. He keeps on doing. Ophthalmologist is also not required to do this. Ophthalmologist is not required to do this. And if there is any doubt, then ophthalmologist, it will be referred to the ophthalmologist. This has to be repeated, mind well, at 6 months, then at 12 months, then 13 to 24 months, and 25 to 36 months. Why it is important? Because it indicates any defect in this red eye reflex indicates possibility of cataract, glaucoma, retinal abnormalities, retinoblastoma, high refractive errors, systemic diseases with ocular manifestation. So now you can see the normal one. Rest all other unequal. If there is squint also, the images will be unequal. If there is a white, if there is a cataract or there is a retinoblastoma, there will be white eye reflex. So this has to be done at birth, at the first discharge, and repeated every 6 to 8 monthly. This is again the most important thing: parental stress and risk factors. ECD is very dependent on parental well-being, physical and mental. So it is quite obvious that parents, if they are tense, they are tense, they're undergoing depressions, they have quarrels in between them, they are not getting along with them, how they can provide good health, good care to their own baby. And who is going to identify? Nowadays, there is a nuclear family. Most of the families are nuclear families. Who is going to identify? It is only the pediatrician who is going to identify this stressor. There is nobody senior in the house who will pick up the stress and tell that you need some treatment or you are under stress. So pediatrician has to do that duty, and that is most important duty, because that is in for your own client. Your child is your patient is your and his development is related to the sound mindset of the both parents. So what are the risk factors for the stressors? Either they are parental, they are child related, or contextual. The parental is a teenage pregnancy, single parent, mental, physical illness, unemployment. Then there is no support system, like I told you that as a nuclear family is the common thing, and there is no support system. Then that is one reason for the stress. Another stress is if there is a baby in a NICU, If baby is in the NICU for 1.5 month, that itself is a very big stress. So then there is some chronic illness, then chronic lung disease after NICU, or there is some other disease, myopathy or something which is incurable. That is again a risk factor for the stress. Then there is contextual, some social issues. There may be the husband may be alcoholic, or he may be addict. These are also things adding to the stress. So how to identify that stress and timely refer that? There is a questionnaire to be administered at the end of the interview. When the parents are coming to you, your growth monitoring is over and whatever immunization is over, you can, at the end of the interview, you can ask them, do you feel constantly worried, stressed, or under tension? Is your sleep affected because of the stress or tension? Do you feel that your interest or pleasure in doing daily activities is less than usual? Do you feel down or low mood or depressed? If the response is either no, sometimes, or mostly, they will score accordingly and interpret and will suggest the action. So mostly response not identified in any of the items. It is a green class. Praise, you have to praise. If something is good, that is called as ALPAC strategy. When there is something, you have to listen. If something is good, that whatever is good, you have to praise about it. And then after praising, you have to suggest. That ALPAC strategy should always be used. You have to praise, positively reinforce, promote positive mental health, elicit stressors if any response, or sometimes and discuss about the coping strategies. Mostly response identified in one item. Listen attentively, empathize, elicit stressors, discuss coping strategies, offer to talk with the family. Mostly response in 2 or 3 items, and mostly response in all items. If these things are found, it is better to send the patient to clinical psychologist or psychiatrist. This is visit-wide health activities about the good health. Many other issues related to health, screen time, sleep hygiene, developing monitoring are dealt with elsewhere in the model. We are not discussing here because of short of time. These are synergized with, let's go to the further side. So what are the ultimately key messages? There is a strong felt need to add preventive and promotive health services to existing office practice. Screening of following issues should be added to the well child visits: newborn hearing, neonatal visual problems, all ages, and parental stress. Parents should be given anticipatory guidance regarding orodental and personal hygiene, age-appropriate physical activity, and danger signs for seeking medical care, and how to maintain healthy home environment, that is by wash technique. Identification of risk factors, patient listening, empathy, discussing positive coping strategies, early identification and referral helps parents deal with the stress. Okay, thank you.
Sorry. This is just for all our medical students with madam's permission. There is a good news and bad news. The bad news that it's already 4 o'clock. And I'm sure all of you have to go and meet your boyfriend, girlfriend, or whatever else. I understand totally. You have my deepest sympathies. But the good news is that the next 3-4 topics are very, very interesting. And the even better news is they are going to be done in short. So just hold on. And you just had a short as well, right? Yeah, short of that we okay, better than meeting your boyfriend. And have you had the short already? Yes. Short of chai.
Sometimes
thank you so much, sir. Thank you so much, Dr. Deshpande, sir. I will request Dr. Yashwant Patil, sir, to felicitate Dr. Deshpande, sir. Our next topic is adequate nutrition. Dr. Anurag Pangrikar is a practicing pediatrician at Beed, Maharashtra. He also has been the president of IMA Beed and organizing chairperson of MarCon 2014. May I request you, sir, to kindly proceed with the next.
Respected teachers in first line, dear colleagues and my friends, it's 4:11. I will be finishing by 4:20. This is the first way how you can make your audience attentive. So they are knowing the limit. It has been said that in ECD that 43% people don't achieve their potential. And to make them attain their potential, this ECD module is there. I was just thinking, Phadke madam had gold medal in every subject. If she would have been treated with ECD module in her childhood, what would have been the result? Or I got the answer that it was the family, her parents, her uncles, her aunts, her brothers, sisters, and they were doing ECD for her during her child. Yes. Because we are in nuclear family, we have to go for this module and have these things. Friends, there are two words in this: adequate nutrition. So just I will introduce these two words, and that will be my scope of my topic. Nutrition is the food that we get for growth and development. And adequate word is important because the recent studies which have shown that around 50% of children at the age of 6 months have started with complementary feeding. But 6 months to 23 months children, only 7% are receiving minimal required food. That means amount, frequency, diversity. So what is nutrition in my 9 minutes talk is amount of food, how many times, that is the frequency. Third is diversity, which will give different macro and micronutrients for growth. And the additional part which has been taught in this ECD is giving food, identifying cues of the child and stopping giving food when he gives cue that yes, I am full now, and giving this food with emotional and social interaction with the child, not only feeding the child, giving emotional and social interaction. And lastly, safety and security of the food. So this is what I will be talking in next 8 minutes. Dear friends, the infant and young child feeding practices, there are few interventions and how much you can improve the child survival. So you can see the first one, exclusive breastfeeding up to 6 months and continued breastfeeding 6 to 11 months. And third one, complementary feeding with continued breastfeeding is 6%. So 20% improvement in under 5 deaths can be done with this nutrition part. So they are ahead of vaccination or insecticide treated material to prevent malaria. In first 6 months, child is exclusively breastfed. But 6 months to 1 year, around 50% of calories come from breast milk and 50% come from complementary feeding. And 12 to 23 months, around 60% calories come from complementary feeding and 33% from breast milk. So this is importance of exclusive breastfeeding till 6 months and timely introduction of appropriate complementary food. We always talk of size, that is growth. But to see the functional appropriateness, the micronutrient supply, that is hidden hunger. So iodine, iron, vitamin A, zinc, and all these factors can be given by selecting at least 4 food groups, which we will be seeing in the next part of my talk. You can see this National Family Health Survey indicators. Less than 3 years breastfed within 1 hour, 41%, we are doing well. Less than 6 months doing exclusive breastfeeding, 54%. But the last 3, breastfed children receiving adequate diet, is only 8.7%. What is so we can have these definitions: minimal meal frequency, at least only 42% are receiving it. Minimal meal diversity. Next food pyramid, we will be talking of diversity. And minimal acceptable diet, that is 6 to 23 months who received both minimum meal frequency, amount, and diversity, is only 6%. So you can go through this chart. So 7 to 8 months should have 2 to 3 feeds. 9 to 11 months should have 3 to 4. And 12 to 24 months should have 3 to 4 feeds with 1 to 2 snacks. And you can see the size of servings, like half cup, 3/4 cup, and 1 cup. Consistency: pureed food, mashed, chopped, finger food. Finger food is the food which child can pick up with his fingers. And you should allow this child around 11 months to pick up and to feed himself. That will make your life easier. If you lose this window of 2 to 3 months, then it is difficult to train child again for self-feeding. So this is food pyramid, which shows the grains. This pyramid is not appropriate. Grains should be on so this just will give you these food groups. So grains, dairy products, legumes, nuts, flesh foods, vitamin A rich foods, and other fruit vegetables. So diverse food is at least 4 out of 7 food groups should be there in yesterday's diet. So whenever you are taking history, you have to ask what child has consumed, and you have to see that at least 4 food groups have been consumed in last 24 hours. And what is responsive feeding? Responsive feeding is many times आपण बाळाला बॉटल देताना पाहतो, तर बॉटल पीत बसणाऱ्या बाळाचं असं असतं की तो ते एक बॉटल घेतो अशी तोंडामध्ये करत त्याचं पीत बसतो, आणि त्याला जे पॉझिटिव्ह डिस्कशन, पॉझिटिव्ह बोलणं आहे मदरचं फीड करताना, आणि या गोष्टी मिळत नाहीत. सो ऑफरिंग फूड बेस्ड क्यूज, अंडरस्टँडिंग लव, पेशन्स अँड प्ले, variety of textures, and it should be enjoyable for parents and child both. So we talked about 11 visits in this ECD. So what we have to do in these 11 visits: first 6 months, see for any concerns regarding breastfeeding, whether attachment is good. For attachments, you should see 4 points: baby's mouth is wide open, lower lip is curled out, chin touches breast. Then for positioning, head and baby's body should be in the same line. Resting on hand, baby's abdomen touches mother's abdomen. All these points you have to see. After 6 months, regarding complementary feeding, you have to tell them regarding responsive feeding and food safety. So it's 419 key messages of my talk: exclusive breastfeeding till 6 months, introduction of complementary feeding, pediatrician should check attachment, positioning, suckling, breast nipple problems if any concerns regarding breastfeeding. Parents should be instructed about exclusive breastfeeding, timely, adequate, safe, and diverse nutrition in complementary feeding. Tell about do's, that is responsive feeding. Responsive feeding means go on giving responses to the child. The advantages and consequences of good and poor nutrition on ECD. Adequate nutrition components in ECD. Thank you.
I just want to emphasize one point. Doctor has done very good about attachment of the breast nipple. I would say that antenatally, if it is done by obstetrician, but usually they don't feel comfortable with pediatrician. So obstetrician role is very important. Doing before pregnancy, before delivery. That will solve many of the problems of the nipple.
I request Dr. Bodhankar sir to felicitate Dr. Pangita sir.
Thank you, sir. In time, you will.
आता
Let me just. So now I have a pleasure in introducing the next speaker, the master blaster of developmental pediatrics in. So तुम्ही कुठल्याही लेवलचे म्हणजे आता फर्स्ट MBBS असाल, इंटर्न असाल, थर्ड MBBS PG करत असाल, 15 पहिलीत असाल की 10वीत असाल, नेक्स्ट 20 मिनिटं तुम्ही just listen to this man, you will get the gist of everything. So he'll be speaking about MCHAT as well as early learning opportunities. And he's none other than my dear friend, Dr. Sameer Dalwai, a very senior, respected, reputed developmental pediatrician from city of Mumbai. And he is in regards to ECD, जे मॉड्यूल आहे की आम्ही आपलं मारे सगळीकडे देशभर 200 करायचे. तर 200 म्हणजे कुठले बाबा? नाशिक मध्ये कुठलं कधी करायचं, हैदराबाद मध्ये काय, कन्याकुमारीत कुठलं करायचं, कच्छ मध्ये काय करायचं, तिथे आहे का फॅकल्टी, 2-3 ब्रँचेस ना एकत्र कसं करायचं, ऑल दिस इज man behind the curtains also. He is the one. So not only in front but behind. So big round of applause to Dr. Dalwai. And I envy all of you what you're going to have a treat for your lifetime in next 20 minutes. Over to you, Sameer.
Pediatrician to VIP children.
Respected madam, respected Bodhankar sir, all my respect, and of course my dear friend Dr. Upendra. वो जब प्यार है वो झलकता है, वो छुपाया नहीं जाता, इसको जताना नहीं पड़ता, अपने आप झलक जाता है. So thank you. The person who got me into ECD incidentally is none other than him.
Yeah, very good.
So thanks so much.
He is the boss of 38,000 pediatricians. Yes.
Is this working? Hello. And like Bodhankar sir said, he is the president of the Indian Academy of Pediatrics, which has 38,000 pediatricians across the country. And he's a man who's single-handedly leading the academy. So with your permission, I'd just like to step out of the podium, madam. People on the last bench, please get up. Last row. Everybody get up and just come out in the aisle. Just get up, get up. No questions asked. Only is commands. Get up, stand up. Yeah, come here. Sit here. Yeah, because see, have you heard about DVT? You heard about DVT? Exactly. So if you sit for long in a cold environment without any mental or physical activity as is happening now, you will get DVT. Come ahead. Yes, get up, madam. Come here. The last line, please stand up. Because I'm also going to come halfway. Come. Get up, come here. All of you, yeah. Come on. Come on, you're wasting your own time. Boyfriend is waiting. Ajo. Come here. Come quickly. Abhi chai bhi ho gaya na. Chalo, come here. So with the permission of my respected madam, the position of the auditorium is such that there are 8 people above 30 years of age, and there are at least 50 people below 30 years of age. So the average age in the auditorium is 16 and a half. So we know their attention span. So if you permit me, we'll interact with them, and permit me for ignoring some of you. This is only directed to the students who have spent their whole day for something which they were forced to do. So I feel very sorry for all of you. So the question we are going to talk about is early childhood development. What we are going to talk about is learning opportunity for the child in the first early childhood phase. What is the early childhood phase? What is the age group we discussed for ECD? From birth to 3 years. So some of you listening, good. Now, just raise your hands, those of you in your own house, maybe a younger sibling also, you also after a big gap, or a brother's child or a sister's child, but you have a child below 5 years in your house. Please raise your hand. Below 5 years in your own house, you have a child. Okay. In your neighborhood, you have a child below 5 years. Below 10 years, you have a child in your house, nearby. Okay, the rest of you are staying in a hostel, that means. How do you teach a child? If you have a child who's 3 years old, 2.5 years old, your brother's child, sister's child, how do you teach a child? Tell me with your experience, what have you done and the child learned from you? Bolo. Yes. Somebody was loudly. Very good. She said we have to do it ourselves and they will mimic. Is that right? Everybody agrees? Wonderful. Why do you think they will mimic? What is happening from their point of view? Imagine now you are that child she's talking about. You stand please. All of you are that child. Why will you mimic what she's doing? What are you doing? What's happening to you? Observation. You are observing her. What else? Before learning, what happens? You are observing her. What else? Is everybody deaf? You are hearing her. What else? Sorry? You are listening to her. You are seeing her. What else? Processing what you have seen as this. But what else before processing? Only we listen and we see. What else? Have none of you touched your mother? Don't we touch? Doesn't the child touch us? Don't we touch the child? So what sense is that? Loudly. Tactile. So vision, hearing, tactile. What else? Smell. Very good. Very often, unfortunately, we don't talk about smell because very often in our experience, smell is usually bad. It can be good also. It all up to you. What else? Do you like a parent who was just sitting throughout your childhood at one place, or she was running around with you and running with you? So you like a sitting person or a moving person as a child? So these are the various things that the child is looking at you and coming at you with all these senses. Then these senses are being processed. Then there will be some memory and so on and so forth. But besides all this, what really wants to make you look at this person and not at the TV? What is that about this person that you want to look at this person or the mother and not the TV or the books or the toys? The role, yes. What did you say? Interaction. What does she mean by that? What does she mean by that?
Two-way eye contact communication.
Eye contact communication. So imagine she's the mother, she's dancing. So the child should like to see. She's singing also in a very nice voice. She obviously is looking very good. She's put some nice fragrance. She's smelling also good. But she's standing in a corner there, looking here and dancing. And the child is sitting in that side of the room. What do you think will happen? Good vision, good hearing. But will there be any learning? So what is most important for learning? Interaction. One message I would like you to take today, whichever year, whatever batch, whoever you are, whichever child you meet on the road, go out with one message. If I want to make a difference in the life of a child, the biggest weapon I have in me is the knowledge that if I interact with this child, I can change his or her life. Which are the professors you like the most? Which are the teachers you like the most? Those who have the most knowledge? No, because Swami Vivekananda said that the greatest knowledge is not in any human being, it's in the library. All the books are already there. So who is the professor you like the most? Or the teacher from your childhood? Look at your junior KG, senior KG teachers. Who's the teacher who comes first to your mind? The teacher was dancing in the corner like that, looking at the wall? Unlikely, right? So this was a teacher who came to you, connected to you, made you feel comfortable or nice. So the two most important ingredients for helping a child is not knowledge, it's whether you are interactive, and second is whether you make the person comfortable. Now, if I am interacting, but I'm interacting like this, will he learn anything? He gets scared. That's called trauma. That's not learning. So that's very important to understand what is the phase of this child. Is he wanting to sleep right now? Is he hungry? Does he want to go to the toilet? That's not the time I will interact with you just now. So it's very important for you to understand that you need to interact and you need to make the other person comfortable. If you do this, it doesn't matter what is your knowledge about the science of pediatrics. Because to deal with a child, you need to be a good and sensible human being rather than a knowledgeable human being. Do you realize that? So whenever you see a child, the first thing you do is 3 words I will give you. These are not from any textbook, so don't write it in your exam because you will fail if the professor hasn't heard about this earlier. Because this is something which I've coined, which is easy for you to remember. And the word is IMP. What does IMP stand for? Important, right? Exam के पहले corner में margin में लिखते हैं ना IMP 1 star, 2 stars, 3.5 star, red line, blue line, highlighted. I stands for interactive. Can you repeat that? I. Interactive. M stands for meaningful. And P stands for purposeful. So interacting is being visually stimulating, appealing, sounding appealing, smelling appealing, looking appealing. All that is interactive, eye contact, etc. So don't stop with this one word answer. Interaction means eye contact. It's terrible. It's the worst kind of trauma. Eye contact, don't be overawed by whatever you read in books. Because it's not comfortable. So interactive is, don't look at the wall when you're talking to somebody. You have some friends like that, you know, looking here and there, talking to some teachers also will be looking here and there in the last line and talking to you. You have to interact, involve the child. M is meaningful. I'm talking in English. I know a little bit of German. I don't know how many of you know. Is there any point if I start talking about German? Actually, when I know that you don't, I will talk a lot of German actually. But it's meaningless because you won't understand the meaning of what I'm saying, doing, or trying to explain. What it means is, if I do this, what does it mean? Why? Because we have decided, all of us. In India, generally when we do this, we means food. Okay, now the girls answered this. This is food. Again, first the girls answer this. What is this? Water, boys. Because we have a different code. Yeah, now there is no difference. Correct. But I wanted to say my college days, my college friend voice. What does it mean? Whatever we have decided कि ये करेगा तो उसका मतलब क्या है? So it is mutual. Both of us know this. Maybe in some other country they don't use this sign for this, or they may use it for something else. We don't know. So when we say meaningful, it's understood that you and I both understand the same thing. So whether it is a meaningful word or a meaningful gesture or a meaningful dance or whatever it may be, in some Bollywood movies you see some very meaningful dances. Earlier they used to show 2 flowers kissing. When they were with the good old days of censorship, they used to show 2 flowers kissing. You know what it meant because it was understood. But the most important part of IMP is purposeful. If there is no purpose in the samne wala, no benefit, fayda nahi hai, so he will not be looking at you. There has to be fayda, matlab. And the only thing I will address to my senior colleagues is this line from Kagaz ke Phool. मतलब की है दुनिया सारी बिछड़े सभी बारी बारी. मतलब नहीं रहेगा तो बिछड़ जाएंगे. It's true for children as well. If they don't find it interesting, they're not going to interact with you. If they do, if you start talking about a 5-year plan to a child, he has no concept of 5 minutes later. Why is he going to understand 5 years later? माँ बोलते हैं ना पढ़ाई नहीं करेगा तो कॉलेज में नहीं जाएगी, पढ़ाई नहीं होगा तो MBBS में नहीं जाएगी, MBBS में नहीं जाओगे तो शादी कैसे होगी, etc., etc. So that doesn't matter to a small child. So it has to be purposeful. If here we are talking about a particular issue,
You have to stick to that. And more than sticking to the issue, that's not purposeful only. You have to find benefit from it. If you don't find interest in listening to what's going on now, you find it more purposeful to go outside and meet somebody who's waiting for you, then you will go. Or you will be here physically, but you will not pay attention because it's not purposeful. So in any interaction with not just a child, but with your mother, father, friend, boyfriend, girlfriend, colleague, teacher, whoever, always keep this. Am I being IMP? And if you stick to IMP, you will become, guess what you will become in that person's life? IMP. Got it? So as simple as that, that's what we have to do in terms of interacting with children. You will automatically learn that what keeps a 3-year-old child on IMP with you is not what will keep a 7-year-old child on IMP with you. Right? Right? Will you figure this out? Can you give me an example? What will keep a 3-year-old on IMP with you? Somebody wants to give me an example of a 3-year-old child? If you have a child in your house, it will be easier for you to answer. What keeps how will you interact now with a 3-year-old child? Will you tell him about the FIFA World Cup football? Will you talk a lot? So this is an important question. Most pediatricians would not know this. Don't talk a lot. Don't talk a lot to a 2-3-year-old child because he hasn't got your vocabulary and he's not going to be Shakespeare tomorrow morning. He doesn't need that vocabulary. So to a 2-year-old, 3-year-old child, be more non-verbal. Dance more. Sing more. Jump more. Play more physically. Fight more. You can have a pillow fight also in fun. But interact physically. Physically. Now I'm not talking about what happens in the hostel. Okay? Physically interact, non-verbally. But with a 7-year-old child, if you try to be so much of physical, he'll get bored and run away. So you have to engage him more verbally because that's what the intellectual capacity becomes at that age. And a 13-year-old child, they will hardly move. They'll be sitting like this. जेवलास का? उद्या काय करायचं? So you have to engage with them more in a way that they are attracted to and it's purposeful for them. So having said this, we are going to stop what we did. Please remember, don't segregate. Oh, this is pediatric knowledge. This is general medicine. This is gynecology. That's not true. Because even human development is like that in domains. There is gross motor, sitting, running, walking. There is social development. There is speech and language and communication as we saw today. There is fine motor. It's very important not to segregate any learning because learning is holistic. What do we mean by it? A child normally, say city like Mumbai, we have this flat system. There are 4 flats on one floor. In Mumbai especially, I'm sure even in Nasik, in one flat there is a Gujarati family, next flat there is a Sindhi family, next flat there is a Muslim family, and the next flat there is a Pillai or a Tamil family. Any child from any of these 4 families who is 2.5 years old will start walking and running, motor development, but he will run into these 3 other households. And guess what he will learn? What will he learn? Loudly, loudly. So we are getting short of time. Different cultures, very good. Not just language. Language is overemphasized. Different cultures, different foods, different tastes. And that's what Dr. Upendra was talking earlier. Variety of foods. Dr. Pangrikar said just now. That's the best way. Not in some tuition class or on some YouTube video that the mothers are looking at. Real life, people around you. That's where the variety is. The variety on the plate will come if there is variety on the floor you live with the human beings that you live with. If you only want to live with one type of human being, your food will also be of one type. Understand that. So it's the diversity in experience that matters to the child and whether you can provide that to the child. So it's very important to understand that this child is able to learn all these cultures. Will he be more intelligent or less? Why do you think Indian guys have become CEOs in all the American companies? Never mind Twitter, that's an aberration. Why are they CEOs everywhere else? Because in India, you know how to deal with the Bengali, Malayali, Gujarati, XYZ, everybody from childhood. You are neurodiverse. You are amazing. You can collaborate with a Japanese guy tomorrow, you can collaborate with a Nigerian, everybody. That's what India taught you. Now, the same thing, look at it from a neurodevelopment point of view. What happens if this child had cerebral palsy? Or if he had a child had in the earlier, maybe some road traffic accident and is not able to walk at the age of 1.5 years. Problem won't be limited only to the motor development, but look at the impact on the social development, language development, cultural development, nutrition and everything else. Do you understand that? So you cannot compartmentalize, okay, this is gross motor only, he has a gross motor problem, cerebral palsy only physiotherapy. No. He will have many deficits. And what does it mean? Forget about a problem. Every child, you need to give everything. Every child, you need to give a variety of stimulation. You need to give a variety. But while giving this so-called stimulation, what is very important, वो इंजेक्शन में सिरिंज में इंजेक्शन दवाई भरने से फर्क नहीं पड़ता है, वो अंदर आईवी में जाना चाहिए. तुम्हारे नॉलेज और स्टिमुलेशन में फर्क नहीं पड़ता है unless it goes inside the child. और वो नीडल क्या है? Needle is IMP. So remember that. And the best way to learn this is catch the first child you see on your way outside the gate, outside the room. Whoever you meet downstairs in the pediatric wards or going down to the ward or on the OPD outside, whoever you meet, stop them. And like Dr. Upendra said in the morning, train मध्ये पण जात असताना कोणी बाळ आपल्याकडे डोकवून बघता पण हे करतो, तसं करा. 3 महिन्याच्या मुलाला funny faces kara. That's the most important stimulation. Raji, you remember Dr. Golden, Professor Golden used to tell us that in Jamaica they were so poor that they collected newspapers. They didn't have money to buy toys, so they created a collage. Told to us in 2007 when we did the workshop in UNICEF in Pune. They just created a collage out of newspaper cuttings, and that was enough for the children to find stimulating because the person who went there with it was interactive. So keep that in mind. Go out, catch the first child you see, and practice it with them. Then whoever is waiting for you outside, 4 o'clock deadline, will be very angry. Be responsive in your response. Don't jump immediately. Take it easy. Let the person calm down. And then practice IMP so you become. Thank you very much. Thanks a lot, Madam. Thanks a lot.
Heard for the first time, and it is really interactive session. IMP. I should say it's a IMP session. Yes. जगा दिया सबको. I'll request Dr. Patil sir to felicitate Dr. Dhanbhai. Okay. Responsive care. Next session will be by Upendra. नाही ना, दोन्ही करून टाकले का सर? दोन्ही करून टाकले का? नाही.
हो, त्याने केले, झाले. दोन्ही झाले. आता फक्त responsive care. Now Dr. Anand Deshpande will take the last part of the session, responsive care giving. Oh.
सकाळपासून हा रिस्पॉन्सिव्ह केअर गिव्हिंग खूप वेळा शब्द ऐकलाय तुम्ही. व्हॉट इज द रिस्पॉन्सिव्ह केअर गिव्हिंग, त्यासाठी आपण आता पुढची 10-15 मिनिटांमध्ये शिकणार आहोत. अँड बेसिकली डिसिप्लिन पाहिजे की नको, डिसिप्लिन असायला हवी का नको, पॉझिटिव्ह डिसिप्लिन, देन पॉझिटिव्ह पेरेंटिंग, ह्या 3-4 गोष्टींना आपण याच्यामध्ये या प्रेझेंटेशन मध्ये हात घालणार आहोत. So whenever the child learning objective, the end of this section, understand the importance of responsive caregiving. Know the attachment and attunement are. Explain the concept of positive parenting to the parents and tell them how to manage unacceptable behavior. We will not be that we will not be covering enough of that. So what? So what is the responsive caregiving? It is observation, recognition, and of an appropriate response to children's needs and cues, movements, emotions, hunger and satiety, sound, verbal and non-verbal communication. जे आई जे करत असते मेजॉरिटीली नीड्स अँड क्यूज मुवमेंट्स इमोशन्स hunger and satiety, sounds, verbal and non-verbal communication. That is a responsive caregiving. What are the effective caregivers? Who are the effective caregivers? Correctly interpret what their children want and need. आईला बऱ्याच वेळा कळतं की काय पाहिजे, कशामुळे रडतंय मूल, भुकेने रडतंय, शूज झाले म्हणून रडतंय, शी झाले म्हणून रडतंय, पोटात दुखतं म्हणून रडतंय, आजारपणाचं रडतंय. सुरुवातीला कळत नाही तिला एखादा महिना, पण हळूहळू विदिन अ मंथ ऑर सो तिला पूर्ण कळायला लागतं. सो that effective caregivers correctly interpret their children's want and needs, respond consistently and appropriately. This promotes the social engagement, cognitive stimulation, and emotional regulation. When the child is born, it is tied with the umbilical cord. At the time of birth, the umbilical cord physical attachment is cut. And there starts the emotional attachment. So एक physical attachment मधनं emotional attachment कडे जी वाटचाल आहे तिलाच actually responsive caregiving म्हणायला हवं. तर because the baby that is coming to the family is completely new to the family, the environment for the baby is new, family also baby is new. So both are getting with each other, they are amalgamating with each other. And that process of amalgamating was done previously very nicely because of again we come back to the same thing, joint family, support givers, caregivers, we back again boil down, but it is not possible to go back to those days. So we are finding newer solution with the same current system. So this bonding, amalgamating of that newcomer in the family is a part of responsive caregiving. So you start the emotional attachment with the baby. So how you do it? It is a serve and return interaction. तुम्ही बॅडमिंटन खेळला असाल, टेबल टेनिस खेळला असाल, there is a service and there is a return. Service and return. The child and adult relationship, responsive, attentive to and fro interactions. Somewhere at around 4-5 months, the baby, at what time social smile ita? When social smile comes? Third MBBS. Social smile saran kadi येतं? जोरात बोला. 2 months far fetched, 1.5 महिन्यालाच येतं जवळजवळ. 1.5 months, around 6 weeks, you will get a social smile. And the social smile is different from the normal smile. Baby keeps on smile from the birth, but social smile is smile in response to when you are talking to the baby, it will smile. That is a social smile. And around 3 to 4 months, you start trying to initiate the conversation with the baby. Maybe around 5 months, 4 to 5 months. So, and that would not be normal conversation. Baby will make some sound, and you will reciprocate with some sound. Parents can engage in several interactions throughout the day, like a serve and return. So baby will make sound like la, you also make a sound like la. Baby will make some other sound, you make similar sound. Baby enjoys that. And if you are making the funny faces, as Samir told, funny faces to the babies, and making the similar sound what baby is making, you also make baby will be extremely happy. This is how the relation goes on, to and fro servicing. After 3-4 minutes, baby will get exhausted, you stop. Again engage into similar session, maybe maybe hour later or 2 hours later, when the baby is well fed, in good mood. Such multiple sessions of serve and return should be done. That increase this return and serve by supporting and encouraging, give it a name. Take turns and wait for the child to respond, practice endings and beginnings. This will create a secure emotional bond and attachment between the parent and infant and child. What are the implications of responsibility? It creates a secure bond, helps the child to develop emotional regulation, capability to adjust and resilience, builds the foundation of trust and early social relationship, provides base for early learning and communication. You remind well, at any age, if everybody wants a listening ear, the baby also wants a listening ear. So baby is making some sound, somebody is recognizing it, taking cognizance of the baby is very happy. And the caregiver around me are bothered about me. That is sort of ego boosting. All the caregivers are dancing around me, they are caring for me. That gives potential ego and totally makes a very sound personality of the baby. So that is the purpose of making a strong, confident personality is the importance of giving responsive caregiving. Builds a foundation of trust in early social relation, provides a base for the early learning and communication, promotes transgenerational pattern of responsive caregiving. Understand this? Promotes transgeneration. If I have received responsive care from my mother, I am able to give responsive care to my child or my grandchild. This is how it goes. It has a transgenerational impact. So if by giving a responsive care to the baby, you are ensuring that that baby will give responsive care giving later on to his baby. So it is a transgenerational. So a stable personality will be a good parent. And the stability of the personality begins right in the 6 months of age. So what is attachment and what is attunement? Attachment, everybody knows. The emotional bond of an infant to the caregiver. Emotional and behavioral interactions with which infant expresses a need for attention, comforts, support, and security. Everybody knows about the attachment. Baby is attached to the mother. Baby is attached to the father. What is attunement? Attunement is like a tuning a radio station. You want 93.5 FM, you tune it. If you want 98.3, you tune it. So attunement, it is a parent's ability to pursue, interpret, and react appropriately to the child's need, attention, or emotions in the given moment. This helps children recognize their own emotions and feelings and regulate them. So attachment and attunement both are important. What is a secure attachment? See this photograph. It looks like this is called a secure attachment. Signs of secure attachment: responds to parents with smiles, makes sounds and or moves mouth, arms, legs, or body in rhythm with the parent's movements, relaxes or gets comforted by the parent, demonstrate reciprocal vocalization, looks uneasy when parent withdraws and excited on the reappearance. This is a sign of secure attachment. If you go in the OPD, pediatric OPD, you will find several such baby with a secure attachment lying in the lap of the mother. So experiences and response. Samir has covered many of these things. The baby explores the world and learns through the basic senses: touch, sound, images, movements, smell, and taste. These are the input devices: touch, sound, visual, smell, taste, proprioception, movement, and memories. And there is processing will that occur in cognitive, positive emotional experiences, pleasure of joy, and negative emotional experiences. And that will lead to the outputs, which are depending on the inputs given, the output will be their response using developmental capabilities, fearful, avoidant response, flight or freeze if the childhood responses are not, experiences are not good. If they are very good, then organized, adaptive response, enjoyable, trusting relationship, ready to learn. An irritable and angry attack response or fight response. These are various types of response that will occur on depending on the what experiences the baby had in early childhood. So what are the types of stresses? Positive stress, tolerable stress, and toxic stress. What is a positive stress? Positive stress is the first day of school. Going to school, it is a stress, but it is a positive stress. It is short lasting. So the normal response, like brief increase in the heart rate and hormone levels. What is tolerable stress? Tolerable stress is any sickness, the baby getting admitted with a pneumonia, with a diarrhea, getting multiple pricks. Amongst the unknown personalities, all doctors, nurses, only known personality is their mother, along with her baby. Everybody comes and examines. So that is a tolerable stress. If you have a very sound responsive caregiving, base of sound responsive caregiving, the tolerable stress can be very well dealt. There will be no long-term effects. And what are the toxic stresses? Broken families. There is multiple quarrels in the family, and somebody is having addictions. These are the toxic stresses. They will have a long-term impact. So positive stresses and tolerable stresses can be very well dealt if there is a sound background of a responsive caregiving. So what are the immediate effect of the stress? Are disrupts brain anatomy, levels, neurotransmitters will be changed. Long-term will be epigenetic modification and cognitive impairment as adults. So what is positive parenting? It's a style of parenting that supports healthy development and adjustment. Components include safe, secure, and loving environment, positive learning environment, positive discipline, reasonable expectation, good parental self-care. So positive parenting means doesn't mean that they are saying everything okay for every demand. Positive parenting does have a component of a discipline, and discipline is a positive discipline. So what is a positive discipline? Positive discipline is a new concept. There should be discipline, and the children should have discipline, but positive discipline. This model focuses on positive aspects of behavior. Concept is that the children are not good or bad, only their behaviors are good or bad. That is the concept behind the positive discipline. So create a safe environment, establish a routine, plan ahead, give a child a feeling of autonomy. If you want child to wear some dress, so give 3 or 4 dresses that you want child to wear and ask which you want. बऱ्याच वेळा गव्हर्नमेंट पण आपल्याशी असं करतं. गिव्ह 4 चॉईसेस, ते 4 पैकी कुठलं तरी एक निवड. ही फील्स दॅट ऑटोनॉमी दिली आम्हाला. मैं आपको 4 ऑप्शन देता हूं, पण चारही त्या माणसाला चारीपैकी कुठलं घेतलं तरी चालणार असतं त्या पर्टिक्युलर माणसाला. असं दिलं की त्याच्याऐवजी हा शर्ट घाल असं म्हटलं की ते मूल म्हणतं की नाही हा मला घालायचा नाही असं म्हणून ते एकदम बाजूला फेकून रुसून बसतं. मला तोच घालायचा आहे. किंवा दुकानात गेल्यानंतर सुद्धा तो तसाच हट्ट करू शकतो. तर त्याला आपणच प्लॅन करून चॉईसेस द्यायचे. 3rd इयर इज अ इयर ऑफ निगेटिव्हिझम. तो तुम्ही कपानी प्या म्हटलं की तो बशीनी पिणं. मग तुम्हाला त्यांनी कपानी प्यावायचं असं असेल तर बशीनी पी म्हणून सांगायचं. 3rd इयरला बरोबर निगेटिव्हिझम असतं. 3rd इयर इज कम्प्लिटली they will do exactly opposite to what you tell. So give a feeling of autonomy, build a positive relationship with the child, establish rules, limits, and values. Establish consequences of unacceptable behavior. म्हणजे positively reinforce unacceptable behavior, acceptable behavior. जे तुम्हाला चांगलं behavior आहे ते positively reinforce करायचं. Do not give in to the child's demands. This is a current problem. Current generation is a problem. They give they don't say no to the child, and that is the big problem, and that is biggest problem, and that is going hampers later on, because later on when it goes to school, somebody is going to say no to him. Then the child gets frustrated, and by that time already it is 5-6 years. It cannot be molded. So don't give in to the child's demand. Hit, shout, bribe, threaten, abuse, label, criticize, or compare with the another child. So these are the positive discipline aspects. There can be a complete half an hour lecture on positive discipline. So how to manage the unacceptable behavior? Commonest example of unacceptable behavior is, if you have heard about the breath holding spasms. Breath holding spasms are like if your baby doesn't like a particular thing, it will cry and will breath hold. And the parents get frightened and they gather around the baby. The water should not be done, they do more. The more and more, 10 people will gather around the breath holding baby. So there, actually it is unacceptable behavior and it should be completely neglected. And by science, we know we are not going to do that workstation. In the workstation, we have a workstation about the breath holding spasm. So breath holding spasm is something that is to be neglected, that is to be taught to the parents. And it is not going to do anything wrong to their baby. There is no life-threatening issue in that. So remove the child from, remain calm, state what is unacceptable, why, remove the child from the situation, label, accept, validate feelings, state the expected behavior, carry out the preset consequences, reconnect with play and affection. What are the strategies? Natural consequences, such as don't entertain the breath holding, that is systematic ignoring, and acknowledge acceptable behavior and time out. Fathers and responsive caregiving. High quality of paternal responsive care associated with positive cognitive outcomes, school readiness and preschoolers, and high IQ in the children. Systemic review of parent intervention program showed that less than 10% of home-based programs involve fathers. What should pediatrician do? Acknowledge father's role and recognize his knowledge of the child and family. Involve him with the goals, content, and expectation as much as mother. Explain ECD and importance of his role. Assess involvement and assign talks. Ask him to attend the well child visits. So father is equally important, and nowadays with nuclear family, fathers are definitely involved. It is, there should be more involved. That is all. So these are the various visits at which time you can look for the responsive caregiving. As somebody told in the morning, the office staff can also observe how much they have responsive caregiving. If all the babies in one corner and all three are looking in the media, then that is not a responsive caregiving. So what are the key messages? There is a strong felt need to add preventive and promotive health services related to responsive care to existing office practice. Pediatricians should learn how to assess attachment and attunement. Parents should be instructed about the positive parenting and how to tackle the problem behaviors. Parents of toddlers should be asked about the sleep hygiene, screen time, and concerns about toilet training. I think that is all.
So much, Dr. Deshpande sir. The last lecture of this session, this workshop, Dr. Anurag Pangrikar will talk on safety and security. Yes, and students should wait because we want to take a photograph with you all along with the faculties. So please don't just go walk outside.
Dear friends, this is the last talk of today's workshop. It is 5:05. It will finish at 5:10 in 5 minutes. So there are two words, safety and security. These two may sound similar, but there is a difference. Safety is from natural things or unintentional things, and security is from preventing damage from intentional. So we have security forces against terrorists. So you can get meaning with this. I will make few sentences and that will elaborate the topic which I want to convey to you. लहान मूल बॉल खेळतंय, बॉल खेळता खेळता त्याचा रस्त्यावर बॉल गेला. 3 वर्षाचा मुलगा आहे, त्याने बॉल फेकला, चुकून तो रस्त्यावर गेला हायवेवर. तर त्या मुलाच्या डोक्यात असं येईल का की इकडून गाड्या येत असतील, मी थोडं थांबलं पाहिजे, सगळ्या गाड्या गेल्यावर जायला पाहिजे? तर नाही. Because this child has tubular vision, there is only one intention that I should get my ball before somebody else takes it away. दुसरा प्रश्न, बेसिनच्या खाली बेसिन क्लीन करण्यासाठी जे फिनेल ठेवलेलं असतं ते बिस्लेरीच्या बॉटलमध्ये भरून ठेवलेलं आहे, पांढरं फिनेल. तर ते त्यांनी दूध म्हणून पिलं तर त्याची काही चूक आहे का? Who will be responsible? Parents. तिसरा प्रश्न, 3 वर्षाच्या बाळाला बुडण्यासाठी समुद्रात, नदीत किंवा तलावातच जायची गरज आहे का? बाथरूम मध्ये बादलीमध्ये असलेल्या 9 इंच पाण्यामध्ये हा बाळ उलटा पडू शकतो आणि त्याचं नाक, डोकं त्या पाण्यात बुडलं आणि असे बाळ दगावलेले सुद्धा आहेत. 4 वर्षाच्या मुलीला रिक्षा ड्रायव्हरने तिच्या जेनायटल्सला टच केलं तर त्यामध्ये त्या मुलीची काही चूक आहे का? पण तिने 3-4 वर्ष हे सहन केलं, कोणाला सांगितलं नाही, यामध्ये चूक कोणाची आहे? पॅरेंट्सची, आणखीन स्कूलची आणि तिच्या पिडियाट्रिशियनची. कारण तिच्या पिडियाट्रिशियननी त्याच्या क्लिनिकमध्ये गुड टच बॅड टचचं एक पोस्टर फक्त डिस्प्ले केलं तर या पॅरेंट्सना कळेल की हे आपण डॉक्टरांना विचारायला पाहिजे. म्हणजे आम्ही पिडियाट्रिशियन शाळांमध्ये जाऊन गुड टच बॅड टचचे लेक्चर्स देतो, पण आमच्या क्लिनिकमध्ये गुड टच बॅड टचचं पोस्टर नसतं. त्यामुळं वी ऑल्सो नीड टू बी सेन्सिटाइज्ड. आणि जेव्हा असा गुड टच बॅड टच होतो तेव्हा फर्स्ट इज रिकग्नाइज इट. म्हणजे बिकनी एरियामध्ये आपल्याला कोणीही टच केला तर तो बॅड टच आहे, तो रिकग्नाइज. सेकंड इज रेजिस्ट, शाउट, मोठ्यांदी नो म्हणून ओरडा. देन रन, त्या सिच्युएशन पासून लांब पळा. अँड फोर्थ, रिपोर्ट टू युअर safe circle. So that can be your teacher, your parents, your elder brothers, or like that. याशिवाय फिजिकल अब्यूज, इमोशनल अब्यूज, सेक्शुअल अब्यूज या गोष्टी बाळांबरोबर होऊ शकतात, लहान मुलांबरोबर होऊ शकतात. अँड निग्लेक्ट, समजा एखाद्या बाळाला आजारी पडल्यानंतर 8-10 दिवस डॉक्टरकडे आणलं गेलं नाही तर दॅट इज निग्लेक्ट. रिपीटेड फ्रॅक्चर्स होत असतील तर दॅट इज निग्लेक्ट बाय देअर पॅरेंट. मुलांना अनहेल्दी ठेवलंय, आंघोळ नाही घातली 8-8 दिवस, स्वच्छता केलेली नाही, दिलेलं मेडिसिन दिलेलं नाही, इट इज निग्लेक्ट. आणि शेवटचा एक पॉइंट, जर तुमच्यापैकी कोणालाही असं दिसलं की एखाद्या बाळाला सेक्शुअल अब्यूज झालेला आहे तर तुम्ही काय करायला पाहिजे? रिपोर्ट टू चाइल्डलाइन 1098 टोल फ्री नंबर. ऑनलाईन FIR दाखल करू शकता. समजा एखाद्याला असं वाटलं तर माझ्याकडे एक बाळ आलं आणि मला ते सेक्शुअल अब्यूज वाटलं आणि मी ते रिपोर्ट नाही केलं, उगाच कशाला आपण त्या भानगडीत पडायचं, पोलीस आपल्यालाच विचारतात, हे पॅरेंट्स आपल्याला विचारतील, आणि मी नाही केलं रिपोर्ट आणि 8 दिवसांनी दुसऱ्या कोणी रिपोर्ट केलं आणि त्या हिस्ट्रीमध्ये मी पण असंही पाहिलेलं होतं, माझ्या निदर्शनास आलं होतं, असं लक्षात आलं, तर माझं काय होतं? यस, 6 महिने जेल आहे. सो इट इज रिस्पॉन्सिबिलिटी ऑफ एव्हरीबडी हू knows that there is some child abuse, child sexual abuse, and you must report it. Otherwise, you are equal culprit to the person who is doing abuse. Thank you.
Thank you so much, sir, for a short, sweet, and very informative session. Children will now know about Child Protection Unit Department. So this is what sir talked about is Child Protection Unit Department. We don't have that in our medical colleges. Maybe that is the next step we should have. Child Helpline is there, but Child Protection Unit Department we used to have in Sydney. It used to be a completely different department. There was a pediatrician involved, there was a psychologist involved, and there was someone from law industry. So that is a thing we need an area of development. Very important session. Thank you, sir. Now we'll have a photo of all the people, all the patient, quietly listening students and all our esteemed faculties and all the dignitaries. Let's have a photo, please.
कसं करायचं हे मागे उभं राहतो पहिलं पेस्ट
पहिल्यापासून आल्या त्यांचा सत्कार
एक फोटो घे ना पेशंटली लिस्निंग पहिल्यापासून बाकीचे सगळे ऑनलाईन वर
कसं प्लॅन करायचं सर? तुम्ही बसा, आम्ही उभे राहतो. खुर्च्या घ्या अजून, फक्त पहिल्या रो मध्येच ठेव. पहिल्या रो मध्ये ठेव.
समीर जे अजून खुशी पहिले स्टुडंट बरोबर काढून नंतर मग हे डॉक्टर मॅडम अंजू आजा अंजू आजा अरे आजा 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 सबका फोटो है कमान कमान मॅडम या प्लीज या मॅडम तुम्ही आणि डीन मॅडम दोघे या आल्या मॅडम सुद्धा आल्या या 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 मॅडम पहिले लेडीज फर्स्ट आतमध्ये जा मॅडम
राजी नायर बसून पुढच्या रूम मध्ये बसा. जेवढे फॅकल्टीज आहेत तेवढे पुढच्या रूम मध्ये बसा. मॅडम बसून
राजी मॅडम या राजी राजी
देशपांडे समीर दलवाई सर
रिस्पॉन्सिबिलिटी चांगलं एक मॉडेल खूप छान आहे एकदम मस्त मॉडेल
बस बस बसतो सर्वात शेवटी. पिंपरी
कसं काढून घ्यायचं
पीजिम बरोबर पण काढायचे
हे कसं हे काढायचं इजिट करू का
काढून घेऊ ना. बसा 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 बसा. नाही मॅडम तुम्ही
Ma'am, I'm here. Ma'am, I'm here. Sir, you please sit.
नायर मॅडम बसा. जी बोलत
अजून एक आहे खुर्ची.
अरे
इथे प्रमिला बस.
अहो सर तुम्ही बसा.
प्रमिला बस.
मी उभारते. सर तुम्ही बसा.
अजून एक खुर्ची आहे मॅडम मॅडम एक खुर्ची आहे
मॅडम बसा
आहे खुर्ची आहे
सर तुम्ही बसा. सर
या सर आपण इथून
थोडे खुर्ची तिकडे घेता सर थोडे तिकडे
एक काम कर थोडे नाही सर होतंय तुम्ही इकडे तुम्ही इकडे
चला का सायली तुका इकडे ना इकडे या ना
येस सर कुठे गेला
तुमचं परत काढायचं पीजी वाल्यांचं पण तरी अगे
अंजू come here. Anju, come here.
अरे अंजू मैडम या शी इज फैकल्टी ये अंजू she is actually faculty for advanced MRP. She was my senior. Come. एक जागा
It's okay. Ma'am, it's fine. It's fine. It's not important.
ची म्हणायची
एवढी मेहनत केली आहे.
चायनीजच अजून पण वापरतात. एक आता इंग्लिश स्टुडंट्सनी जा थँक्यू पीजी स्टुडंट बरोबर काढले अरे आमच्या अमृता एक मिनिट विष्णू सर नहीं ते कार्तिक मध्ये योगेश पवार सर योगेश विष्णू
Yes. Come to the all the
तो गेलाय मॅडम.
हो अरे मला विचारायचं आहे. कुठे तुम्ही आता
नाव सगळ्यांना कोण आहे ते? या ऑस्ट्रेलियन लेडी. ऑस्ट्रेलियन लेडी. बरोबर. She was with me also.
Thank you all faculties and participants. Now I declare session is over.